अनम्यूट केलंय मी.
बोल ना मग.
अच्छा, president is not seen. There was a phone call from Mira Road whether we have lodged a complaint. Cyber crime cell. Have we lodged a complaint against that last time cyber attack?
No, we haven't.
No.
So we haven't. Jagdish,
Okay,
we
then
will do it.
I have to inform him because there was a phone call today morning whether we have lodged a complaint. So I said I will inquire with my team and then let you know. So evening I will take that Mr. Gunchkar, he is a PI there. So it's okay.
Start.
Go ahead.
Good afternoon, everyone. I welcome you all on behalf of Palghar Academy of Pediatrics to our webinar on autism. Autism म्हणजे काय? Autism म्हणजे स्वमग्नता. आता याला अजून सिम्प्लिफाय केलं तर जसं जोशी सर सांगतात तसं जगाशी कट्टी. म्हणजे लहान मूल जेव्हा जगाशी कट्टी घेतो तेव्हा काय करतो, तो कोणाशी बोलत नाही किंवा डोळ्यात डोळे टाकून बोलत नाही, सगळं तोडफोड करतो, रागावतो. तर याला शॉर्ट मध्ये आपल्या लँग्वेज मध्ये म्हटलं तर ऑटिझम म्हणतात. तर या ऑटिझम मध्ये काय होते, आपल्या ओपीडी मध्ये पेशंट आल्यानंतर त्याला काय काय बघायचं आहे, ते एकदा ऑक्युपेशनल थेरपिस्ट कडे गेल्यानंतर त्याचं काय इम्प्रूव्हमेंट आहे किंवा काय डेट्युरिएशन आहे, त्याचं स्पीच कसं आहे, आणि ह्या सगळ्या भरपूर प्रश्नांचं उत्तर देण्यासाठी आज आपल्याकडे आहेत ह्यासाठी तज्ञ डॉक्टर लीना देशपांडे, जे डेव्हलपमेंटल पीडियाट्रिशियन आहे. आय वेलकम यू मॅडम टू आवर वेबिनार. And to moderate the session, we have Dr. Shailesh Baron, who is a practicing pediatrician in Virar. So now over to Dr. Shailesh Baron.
Thank you, Palghar Academy. Thank you, Lina, for saying yes for this webinar. Autism in late 80s and early 90s, when we were medical student or when we were doing our post-graduation, was a subject of means not to touch आणि त्याला ऑप्शन मध्ये टाकायचं. त्यावेळी ऑटिझमला मराठीमध्ये म्हणायचं तर तो वेडा आहे किंवा इंग्लिशमध्ये तो मेंटल रिटार्डेड आहे. दॅट वॉज जनरलाइज टर्मिनॉलॉजी. देर वॉज नथिंग लाईक ऑटिझम इन अवर करिक्युलम दॅट टाइम. लेट 90s आणि 2000 मध्ये देन द टर्मिनॉलॉजी केम एज ADHD, attention deficit hyperactivity. So थोडं जरी abnormal behavior वाटलं की त्याला hyperactive आहे, attention deficit आहे, but there was nothing like autism. 10 years back I had attended one webinar where autism was described by Dr. Vibha Krishnamurthy, and after that attending various OPDs and then looking at the kids properly and then trying to find out what it was autism. So in last 5 years we have started recognizing autism as a disease. We have started referring them to developmental pediatrician. We have started giving them different forms of therapy like occupational therapy and speech therapy, but still we don't have a reformed structural program to treat autism in this particular area at least. Goregaon has a proper one structural center like New Horizon. Vashi has Lina's center. Then Borivali मध्ये आता एक सेंटर सुरू झाले. वर्ली मध्ये त्यांचा डॉक्टर विभा कृष्णमूर्तीचा उम्मीद आहे. बट इन वसई, विरार, नालासोपारा or up to Palghar there is no as such reformed center. So we requested Dr. Lina ki why don't you just tell us everything about autism, and once we diagnose it as autism, how to go about and how to follow up them and how to look after them and what parts to basically intervene and when to intervene, who will be intervening, where like when occupational therapy will come inside, when speech therapy will come inside, when psychologist will come inside, when special educator will come into the play. So जे अख्खं ऑटिझम ट्रीटमेंटचे जे स्ट्रक्चरल प्रोग्राम आहे ते कसं
Shailesh, you're on mute. Unmute.
सो ते डिस्कस करण्यासाठी आपण लीना मॅडमना इथे बोलवले आहे. सो आय नो डॉक्टर लीना देशपांडे सिन्स 94-95 नाही 84-85
काय नाही 94-95.
हा. सो त्यापासून मी ओळखतो आणि शी इज एक्सलेंटली गुड डेव्हलपमेंटल पीडियाट्रिशियन अँड शी हॅज हर ओन सेंटर इन वाशी. आय जस्ट रीड अबाउट हर. So after MD Pediatrics, she has trained and worked in UK for 10 years in neurodevelopmental pediatrics. She's a founder of ICAN Child Developmental Center in Palghar, Navi Mumbai. She is a visiting consultant developmental pediatrics, Apollo Hospital, MGM Hospital, Navi Mumbai. She is a joint national coordinator for TOT neurodevelopmental disorders, West Zone convener for TOT autism, poor scholastic performance. She is a member IAP task force for IAP national consensus guidelines on ADHD, autism, newborn hearing screening, and learning disability. She is a member accreditation committee for institute applying for IAP fellowship program in neurodevelopmental pediatrics. She is the academic editor of IAP handbook of development and behavioral pediatrics and faculty on various forums. So I'll stop sharing my slide and over to Lina for further.
Thank you, Shailesh. I think first thing is, as you said, की आज ऑटिझम बद्दल आपण सगळं शिकूया. तर ऍक्च्युअली ऑटिझम बद्दल सगळं मलाही माहिती नाहीये. आणि इफ एनीबडी सेज दॅट त्यांना ऑटिझम बद्दल सगळं माहिती आहे, तर आय डोंट थिंक दॅट इज ट्रू, बिकॉज देर आर व्हेरियस लेयर्स आणि बऱ्याच गोष्टी आपल्याला अजून माहिती नाहीयेत ऑटिझम बद्दल. ऑटिझमचा प्रत्येक जर आपण भाग घेतला, इफ यू टेक एव्हरी स्मॉल पार्ट राईट फ्रॉम सिम्पटम्स टू द होल प्रोग्राम, each part can take 3, 4, 5 days of workshops. So आता आपल्या ह्या 1.5 तासामध्ये काय काय कव्हर होऊ शकतं, लेट्स ट्राय अँड डू दॅट. पण त्याच्या आधी लेट मी थँक IIP पालघर, हेमंत सर, जोशी मॅडम, वैभवी, शैलेश. Thank you very much for inviting me here today. As Shailesh said, I know him for many years. In fact, मी मला वाटतं KM वाडिया जॉईन केलं as a first or a first poster, आणि he was a 5th or a 6th poster. So when he says he left autism ADHD for option, आम्ही पण आमच्या सिनियर्स कडनं शिकलोय. त्यामुळे आम्ही पण आमचा तो ऑटिझम ADHD LD हा सगळा आमचा ऑप्शनला होता MD ला. आणि नंतर आम्हाला कळलं, we used to think that it is some weird wonderful illness of the West, but after I went to UK, I realized we just could not see it because we did not know about it. In India at that time, we were so focused on infections and saving lives. All these things really we could not learn in our MD. But having come back, when I came back to Navi Mumbai to settle, तेव्हा कुठे हळूहळू दिसायला लागलं की, आणि the initial age of presentation used to be something like 6 or 7 years of age. This I am talking in 2006 वगैरे, when I came back. इनिशियली जेव्हा मुलं शाळेत जायची आणि तिथे प्रॉब्लेम व्हायचा, तेव्हा टीचर्स रेफर करायचे. सो 6, 7, 8 पर्यंत ही मुलं पुढेच यायची नाहीत. पण आय थिंक ओव्हर द लास्ट 10-15 years, because of all the CMEs and the conferences, the awareness has really increased and we are picking up children much earlier. आणि आता जे माझ्याकडे रेफरन्स होतात, almost 2 to 3 years आधीच होतात. Most of them are less than 3. Many are coming less than 2 years of age. So let me start the topic. I'll just share my screen. Okay, it can be seen.
Yeah. Yes.
Okay, so what I am going to do, I have put few cases. जसं आपण सुरुवातीपासून एंड पर्यंत थोडेसे केसेस नाही करूया, म्हणजे आपण सध्या ओपीडी मध्ये काय करतो, काय ह्याच्यापेक्षा जास्त आपण काही करू शकतो. दिस इज व्हॉट अवर टुडेज अजेंडा इज. वी ऑल सी दिस केसेस व्हेरी फ्रिक्वेंटली इन अवर ओपीडी. सो आय एम जस्ट गोइंग टू स्टार्ट विथ द फर्स्ट केस. and I invite anyone, who would like to talk about this case. If this case comes to the OPD, what are you going to say to the parents? So, Ata, as Shailesh said, the incidence, the prevalence of autism spectrum disorder has become so high. So it used to be something like 1 in 10,000 आणि आता आपण 1 in 100 काय 1 in 50 काय अशा असे prevalence जेव्हा बोलतोय तेव्हा you will certainly get a parent who will be like this, की they bring their 1-year-old child for your opinion आणि त्यांचं म्हणणं आहे की त्यांचा 4 वर्षाचा जो पुतण्या आहे त्याचं डायग्नोसिस कुठेतरी पुण्याला ऑटिझम म्हणून झालेलं आहे. तर they all that they want to know is their 1-year-old child okay or not. यावेळेस what should be our immediate reaction in the OPD when the child when the parents come? Dr. Anjali, Dr. Shailesh has nominated you to take the first case. Vaibhavi, do you want to start? Vaibhavi, you can start.
Yeah, madam will first observe the child. When he's diagnosed with autism, we'll ask.
पुतण्या is diagnosed with autism. हा 1-year-old असेच तुमच्याकडे घेऊन आलेले की बाबा ह्याला काही त्रास आहे का बघा बघा. We have read that it is genetic in nature.
Okay. So we'll observe the child in the OPD when he enters, and we'll see while talking to the child, we'll see his eye-to-eye contact, whether he's talking to us properly. If we ask him to point the things, whatever is there in our OPD, we'll ask them to show the things or ask them to speak his name. And
okay, so what you are looking for is some developmental milestones in the child which are related to more than आपण जे नेहमी बघायचो की चालतो का आपलं फिजिकल पर्यंत संपायचं आपण जेव्हा MD करत होतो तेव्हा. So we need to look at a little bit more. आणि the best way actually to do this is by developmental surveillance आणि developmental screening. म्हणजे आपल्याकडे एखादं टूल रेडी पाहिजे जे आपण सांगू बाबा पेरेंट्सना की हे बघा हे सगळं तो करतोय किंवा नाही करत. सपोज करतोय आपण टिक मार्क करू शकतो आणि त्याला एक फॉलोअप मध्ये ठेवू शकतो. करत नसेल तर पुढे काय करायचं ह्याचा विचार करू शकतो. So there should be some developmental surveillance or screening tool which you should be having. I'm not going to talk a lot more in detail about this, but I will mention this. I don't know whether you are aware of, there was this developmental surveillance chart which was linked to immunization, which I had made about 10 years back. आणि लोकल सगळे pediatricians हा चार्ट वापरत आहेत आणि बरेचसे नॅशनल pediatricians they are using this chart and they are giving me a very good feedback. So this is something which you can try and do. तर ह्याच्यामध्ये मी काय केलंय, हा आपला इम्युनायझेशन चार्ट आहे फॉर हुएवर हॅज नॉट सीन इट. इथे आपले एज आहे, नंतर मग कुठले वॅक्सिन्स आहेत आणि देर इज अन एक्स्ट्रा कॉलम हिअर फॉर डेव्हलपमेंटल सर्व्हेलन्स. आणि डेव्हलपमेंटल सर्व्हेलन्स म्हणजे आपण प्रत्येक गोष्ट जर विचार करायला गेलो ग्रॉस मोटर फाईन मोटर becomes difficult at that time. So what I have done is I have actually put one from every skill area for every immunization time. So एक gross motor, एक fine motor, एक speech, एक understanding, एक play. So असं झाल्यावरती काय होतं, suppose it is like this. So suppose a child has come at 18 months for your booster. Sorry. आपलं वॅक्सिन सगळं हे लिहून झाल्यावरती हा जो डेव्हलपमेंटचा एक एक्स्ट्रा चार्ट, वॉक्स अनसपोर्टेड झालाय का, स्क्रिबल करतोय का, मिनिंगफुल वर्ड्स आलेत का, पॉइंटिंग करतोय का, प्ले आहे का, हे जर असेल तर आपण एक स्ट्रिक्ट टिक मार्क करू शकतो आणि वी कॅन टेल द पेरेंट्स की दिस सिंग्स फाईन. सपोज नाहीये, सपोज द चाइल्ड इज नॉट वॉकिंग अनसपोर्टेड at 15 months or 18 months, we can look at that ahead. But this is a surveillance chart, so it is not a diagnostic or a screening chart. So we all of that we can come to know की बाबा ह्याचं पुढे काय करून घ्यायची गरज आहे का आपण सोडून देऊ शकतो. आता हा चार्ट, हा जो असे ना सर्वेलन्स चार्ट आणि स्क्रीनिंग चार्ट खूप आहेत आपल्याकडे अवेलेबल, इंडियामध्ये म्हणा, आउटसाइड म्हणा, पण बऱ्याचदा काय होतं तो कुठेतरी राहतो आणि तो आपला होत नाही. वेन वी पुट इट राईट नेक्स्ट टू द इम्युनायझेशन, इथे त्याच एका पेजवरती तुमच्या फाईलवरती ते पटकन पिकअप होतं पेरेंट्सच्या आणि तुमचं, आणि ते लक्ष जातं. सो प्रत्येक वेळेस फक्त तुम्हाला एक चारच वापरायचे आहेत. आणि सिमिलर थिंग वेन द चाइल्ड इज 9 months, हे सगळे मी केलेले आहेत. So I think this is a useful chart to use, because what happens is at 2 years, suppose this child is not, if this child is not saying several meaningful words at 18 months, that is a concern and you are going to look at that ahead. Okay, so hey, this is one thing to remember. Second thing to remember in this child is we need to know which are the factors which are associated with increased prevalence. So इथे मग ह्या मुलाचं आपण म्हणतो की genetic आहे. We know that one nephew is or a cousin has autism. So what are the factors associated with increased prevalence? Sibling with autism, extra advanced marital age, and all these various with child, and these factors we need to be aware of, and along with that we need to be doing a developmental surveillance of any parent or any child who has come with a concern or query about a child development. In fact, we should be doing developmental surveillance of all children, definitely high risk. Okay, so that is the first case. Now coming to the second case, this is again a very common scenario. 2-year-old child, born at 36-week gestation, birth weight was okay, no problems in perinatal period, and what he has come to you is for concerns of viral fever, सर्दी खोकला, आणि तो सॉर्ट आउट झाला. 10-15 मिनिटं तुमचं बोलून झालं, आणि पेरेंट्स while they are leaving, they just say दरवाजाकडे, हा ना अजून बोलत नाही, फक्त बॅबल करतो, हा 2 वर्षाचा आहे पण तो बोलत नाही. What should be our response?
Ma'am, since the parents while leaving have told us he is not speaking properly, then we'll have to evaluate why he is not speaking. For that, we'll have to again see the milestones, what all he's achieved till now, and whether we'll have to go ahead with doing an BERA test, and we'll do the if we can do the MChat. We can tell them to wait outside and fill the MChat, and according to that we can see what all deficits are there or the plus points.
Correct. म्हणजे आता इथे when the आपली नॅचरल टेंडन्सी काय असते, पेरेंट्स when they are trying to, they are just outside, going outside the OPD, आणि ते असं काहीतरी एक्स्ट्रा बोलतात. बाहेर 50 पेशंट थांबले आहेत, आय एम शुअर शैलेश तर 100 पेशंट थांबलेले असणारच. पण हे जे आहे, मग आपण जनरल टेंडन्सी असते की ह्यावेळी जेव्हा पेरेंट्स विचारतात ना, तेव्हा लॉट ऑफ टाइम्स व्हॉट हॅपन्स इज पेरेंट्स ओनली वॉन्ट अश्युरन्स फ्रॉम यू और रिअश्युरन्स, बिकॉज त्यांना वाटतंय की काही प्रॉब्लेम नाहीये, बिकॉज इफ देयर वॉज अ कन्सर्न दे वुड हॅव कम फॉर दॅट, बट दे फील ऑल इज वेल. फक्त एक डॉक्टरचं टिकमार्क घेऊया आपण की सगळं व्यवस्थित आहे. किंवा बऱ्याचदा कसं होतं, मदरला वाटतं की प्रॉब्लेम आहे आणि फादरला वाटतं की काही नाही, सगळं मी पण उशिरा बोललो होतो, आणि ऑल दे वॉन्ट फ्रॉम द डॉक्टर इज अ रिअश्युरन्स दॅट ठीक आहे, आम्ही डॉक्टरना विचारून झालं, ते बोलले सगळं ठीक आहे. पण आपला रिस्पॉन्स आधी, म्हणजे आता रिसेंटली आपलं हे एमचॅट वगैरे आपल्याला अवेअरनेस आलेला आहे, पण युजली काय असायचा, इफ यू आर इन अ हरी इट माइट वेल बी की नो ना युअर राईट, मुलं काही काही उशिरा बोलतात, तुमचा मोठा मुलगा पण उशिरा बोललाय, किंवा वी गिव्ह सम ऍडवाइस लाईक नो आपला तुमच्या घरात तर तुम्ही मराठी, तमिळ, कन्नडा, हिंदी, गुजराती सगळं बोलता, एक लँग्वेज बोला. किंवा यू माइट से दॅट तुम्ही म्हणता ना सगळं कळतंय, मग लेट्स वेट टिल 3 years ऑफ एज. सो अशा प्रकारचे थोडेसे पेरेंट्स ऑल्सो ट्राय टू गेट दिस थिंग्स फ्रॉम अस सो दॅट दे आर रिअश्युअर्ड. आणि आजकाल बऱ्याच ठिकाणी मी हे बघितलंय की पेरेंट्स आज की काहीतरी ब्रेन टॉनिक तरी द्या, आणि मग आपलं काहीतरी एक फॅटी ऍसिड किंवा कसलं तरी एक ब्रेन टॉनिक आपल्याकडनं ते लिहून घेतात. आणि ह्याच्यामध्ये काय होतंय की दिस इज एक्झॅक्टली व्हॉट वी शुड नॉट बी डुइंग. कारण आपण हे एकदा केलं की द नेक्स्ट टाइम द पेरेंट इज गोइंग टू बी वरीड अबाउट देअर चाइल्ड स्पीच इज 6 months or बिकॉज एनीबडी टॉक्स अबाउट स्पीच, द अदर पर्सन इज गोइंग टू टेल देम नाही पण डॉक्टरांनी सांगितलं ना सगळं छान आहे, मग कशाला तू उगीच काळजी करते. मग ते 3 ते 6 ते 1 वर्षानंतर मग पुन्हा पुढे प्रगती नाही झाल्यावरती हे प्रश्न पुन्हा येतात. So what we need to really do is we know what we want to know, as we rightly said, की हे फक्त स्पीच आहे प्रॉब्लेम का तो लँग्वेज आणि कम्युनिकेशनचा प्रॉब्लेम आहे. आणि आय थिंक वी ऑल नो द डिफरन्स बिटवीन स्पीच, लँग्वेज अँड कम्युनिकेशन. स्पीच इज ओनली वर्ड्स कमिंग out of our mouth. They can be meaningful or just repetition. Language is a lot more, where there is you have to understand, process and communicate using words which are grammatically correct. And communication is verbal through language and non-verbal through gestures. Understanding gestures and communicating through gestures. So there is a lot of things in communication. आपलं जे ऑटिझम आहे हा कम्युनिकेशन डिसऑर्डर आहे, पण त्याच्यामध्ये हे सगळं काही वन और मोर कॅन बी देअर. सो वेन अ पेरेंट इज टॉकिंग अबाउट जस्ट स्पीच, वी नीड टू मेक शुअर ऑल दिस इज फाईन. And with increasing prevalence of autism, we should not miss early symptoms of autism spectrum. And the reason I have underlined early here is speech delay is actually not an early symptom. There will be more symptoms before that, which we may or may not be able to have picked up, because early symptoms can be missed. And most common presenting symptom काय बनतं की हा माझा मुलगा बोलत नाही. This usually between 2 to 3 years of age. But autism is not a speech delay problem. It's not a speech problem. It's a communication disorder. And communication can be non-verbal and verbal. So verbal च्या आधी आपलं non-verbal जे येतं. So if non-verbal is affected, symptoms of autism spectrum will be present much earlier also. आणि हे क्विकली मी हा एक चार्ट ठेवलाय आणि आय रिअली नॉट गोइंग टू गो थ्रू इट. पण कम्युनिकेशन कॅन बी रिसेप्टिव्ह, एक्सप्रेसिव्ह, रिसेप्टिव्ह नॉन वर्बल, रिसेप्टिव्ह वर्बल, रिसेप्टिव्ह नॉन वर्बल, एक्सप्रेसिव्ह वर्बल. आता ह्याच्यामध्ये हे जे काही मी घातलेलं आहे की त्याला बाय बाय कळतं, त्याला पॉइंटेड तुम्ही काहीतरी दाखवलं तर ते कळतं, हे आपले जेस्चर्स त्याला कळतात. दिस इज रिसेप्टिव्ह. आपलं बोलणं आपण नाही म्हटलं तर कळतं का, आपण त्याच्या नावाने हाक मारली ते नाव त्याच्यासाठी आहे हे कळतं का, ही आपली भाषा त्याला समजते का, आणि बोलण्यामध्ये तो आपल्याशी जेस्चर्सनी कम्युनिकेट करतो का, तसं बाय करतो का, किंवा हात घ्यायला हात वरती करतो का, किंवा पॉइंटिंग करतो का, किंवा स्माइल करतो का. आणि मग एक्सप्रेसिव्ह आलं, स्पीच, कुईंग, बॅबलिंग, वर्ड्स, मिनिंगफुल वर्ड्स. सो ज्या हे आपले पेरेंट्स घेऊन आले ते फक्त हे एक्सप्रेसिव्ह किंवा मिनिंगफुल वर्ड्स आलेत. फॉर ऑटिझम हे सगळे सिम्पटम्स जे आहेत हे त्याच्या आधी येतात, वर्ड्सच्या आधी येतात. सो वेन वी टॉक अबाउट अर्ली पिकिंग अप, वी वॉन्ट टू मेक शुअर की हे सगळं आहे का. सो ह्याच्यासाठी ना आम्ही ऍक्च्युली एक नवी मुंबईमध्ये हा एक चार्ट बनवला होता, आणि हा प्रत्येक पीडियाट्रिशियनला एक आय थिंक 3-4 years बॅक प्रत्येक पीडियाट्रिशियनच्या केबिन मध्ये वेटिंग एरियामध्ये लावला होता की बाबा 6 monthsला बिग जॉयफुल एक्सप्रेशन्स आहेत का, 10 महिन्याला मुलगा रिस्पॉन्स देतो का. सो दॅट one the pediatrician is aware, but second is the parents when they are waiting in the room for vaccination or other problems, आणि हे त्यांना दिसतंय, they might raise a concern with you if these symptoms are not there. So this is a very useful chart to put. All right. हे सगळं ठीक आहे, पण अर्ली साइन्स ऑफ ऑटिझम हे आपण म्हणतो ना कॅन समटाइम्स बी क्वाइट सटल, आणि जनरली आपल्याला ते रेट्रोस्पेक्टिव्हली दिसतात. जेव्हा होतात ना तेव्हा बऱ्याचदा लक्षात येत नाही. पण देर आर 3 symptoms which we find very worrying if it is seen. One is orientation to need, second is meaningful eye contact, आणि third is joint attention. Joint attention म्हणजे तुम्ही काहीतरी दाखवता आणि तिकडे तो मुलगा बघतो. ओके, तो बघ फॅन, जेव्हा एखादा बाळ समोर बसलाय तो बघतोय का आपल्याकडे, आपण जेव्हा फॅन दाखवतो तिकडे बघतोय का, आणि नावाने जेव्हा हाक मारतो तेव्हा वळून बघतोय का. सो यू कॉल आउट अमेय म्हटल्यावरती मुलांनी बघितलं पाहिजे ते बघ काय, त्याच्या ह्या तिन्ही गोष्टी आपल्या त्या एका ह्याच्यामध्ये होऊन जातात. Okay, so these are some early symptoms. But this child whom we have seen, who are the parents, is second case where parents mention the child is not speaking. Our response is आपल्याला हे सगळं फाइंड आउट करायचंय की नॉन वर्बल, वर्बल, आणि ह्या सगळ्या गोष्टींचं प्रत्येक ह्याचं सिम्पटम विचारणं सोपं नाहीये in a busy OPD. And that is why we should do a screening test, which is the MCHAT. It should be done in all children at 18 and 24, definitely if there are concerns about speech or communication. आणि ह्याचा बेनिफिट काय आहे, इफ वी कॅन पिकअप दॅट देयर इज अ डेव्हलपमेंटल और ऑटिझम स्पेक्ट्रमचे सिम्पटम्स अर्ली, दिस विल हेल्प ट्रीटमेंट ड्युरिंग दिस क्रुशियल सिंग्युलर टाइम इन द चाइल्ड्स लाइफ when any intervention could have greatest impact, less than 2, less than 3 years of age. आणि आपल्यासाठी काय बेनिफिट आहे, इट इज एथिकली रिक्वायर्ड ना, कारण डिसऑर्डर इज ऑलरेडी इन प्रोग्रेस. इफ वी कॅन डिटेक्ट इट अर्ली, वी कॅन ऑफर अर्ली इफेक्टिव्ह ट्रीटमेंट. सो दे लेटर ऑन मे बी मेडिकल लिगल इम्प्लिकेशन्स की बाबा स्क्रीनिंग टेस्ट आहे आणि झाली नाही. सो आय थिंक वी मस्ट स्क्रीन, नो क्वेश्चन अबाउट दॅट. आणि कुठलं हे MCHAT, as Vaibhavi said, we have used it for a long time. It is validated. It is from 16 months to 20 months, validated. Takes 5 minutes. Only 20 questions. All many languages, many Indian languages. But this, and I'm again not going to go through this, but what I want to bring to your attention in these 20 questions, आता जर मी हा तिसरा क्वेश्चन बघितला, डज युअर चाइल्ड प्ले, प्रिटेंड ऑर मेक बिलीव. ओके, किंवा विच इज आस्किंग अबाउट द प्ले ऑफ द चाइल्ड. किंवा मी पाचवा बघितला, द चाइल्ड मेक्स अनयुजुअल फिंगर मुवमेंट्स का. दिस इज अबाउट रिपिटेटिव्ह मुवमेंट्स ऑफ द चाइल्ड. डज द चाइल्ड पॉइंट विथ वन फिंगर, दॅट इज अबाउट पॉइंटिंग. सो दिस इज जेस्चर. सो ह्या 20 क्वेश्चन्स मध्ये एकही प्रश्न वर्बल स्पीच वरती नाही. ह्याचा अर्थ काय, ऑटिझम मध्ये वर्बल स्पीच शेवटचं आहे, त्याच्या आधी हे 20 गोष्टी आल्या पाहिजे. ओके, सो दिस इज द ब्युटी ऑफ दिस चार्ट, दॅट ऑल दोज सिम्पटम्स जे आपण ना खरं आपल्या एमडीच्या वेळेस आपण तेवढे विचारायचो नाही, की मुलगा खेळतो कसा, मुलगा जेस्चर्स करतो का, मुलगा तुमच्या चेहऱ्याकडे बघतो का, हे सगळे प्रश्न इथे सॉल्व्ह होऊन जातात आणि येस आणि नोच्या माध्यमातून. आणि देन देर इज स्कोरिंग सिस्टम, अँड इट इज अ व्हेरी क्लिअर स्कोरिंग सिस्टम. I'm not going to go through this because it is very self-explanatory, and if anybody wants, we can send the PDF across. आणि ते सगळं ह्याच्यामध्ये आलेलं आहे. आणि ना ह्याच्यामध्ये बऱ्याचदा काय होतं, प्रश्न कळत नाही पेरेंट्सना, तर हे अगदी सिम्पल वर्ड्स मध्ये क्वेश्चन्स विचारले गेले, which even your receptionist can do if the parents need help. So you just start using the MChat if you are not already using. ओके, आता पॉझिटिव्ह एमचॅट म्हणजे काय, एमचॅटचा ना फॉल्स पॉझिटिव्ह रेट खूप जास्त आहे. म्हणजे काय की सेन्सिटिव्हिटी खूप हाय आहे, पण स्पेसिफिसिटी ह्या स्क्रीनिंग टेस्टची कमी आहे. कमी म्हणजे 60%. सो ह्याचा अर्थ काय, इट इज नॉट अ डायग्नोस्टिक टेस्ट फॉर ऑटिझम, इट इज ओनली अ स्क्रीनिंग टेस्ट. जस्ट बिकॉज एमचॅट इज पॉझिटिव्ह डज नॉट मीन द चाइल्ड हॅज ऑटिझम. आणि हे आपल्या लक्षात ठेवलं पाहिजे, कारण पेरेंट्स सडनली गेट व्हेरी स्ट्रेस्ड, आणि आपण त्यांना त्यावेळेस कसं काउन्सिल करतो इज द मोस्ट इम्पॉर्टंट. की डज नॉट मीन दॅट द चाइल्ड हॅज ऑटिझम, बट वी नीड टू डू फर्दर थिंग्स. पण ह्याचा अर्थ इन एमचॅट द अदर ब्युटी इज, इफ यू एमचॅट इज पॉझिटिव्ह, देर इज मोर दॅन 90% चान्स की मुलाला काहीतरी डेव्हलपमेंटल प्रॉब्लेम. इट माइट बी 50% चान्स की ऑटिझम आहे, पण 90% की काहीतरी डेव्हलपमेंटल प्रॉब्लेम. So it's a very worthwhile test to do, because you will pick up a lot of other developmental issues also in the child, and you can intervene. And if you do this at 18 months and 24 months, this is early pickup of a child. Some points I have put to remember in this case: never ever miss a hearing issue. Some other differentials of autism I have put in, and एक म्हणजे vision problems. And I remember a child, this was many years back, this was a premature child, extremely premature child with a very stormy NICU period. And he was referred to me for query autism by the speech therapist. And what he actually had, because there was no eye contact, what he actually had was, he was completely blind in one eye, secondary to retinal detachment because of ROP, and very poor vision in one eye. So vision, eye contact, all those things we have to keep in mind. Hearing issues, vision issues, poor exposure, emotional deprivation, excessive screen time, we cannot forget, because autism is a problem with social interaction. And here poor exposure, neglect and screen time is going to affect social interaction. So आपण त्यांना expose केलंच नाही तर ते शिकणार. Of course, the other important group of autism mimics are those other developmental disorders and genetic disorders like tuberous sclerosis, neurofibromatosis, which may have autism as one part of the entire syndrome. Now, there are some children, हा आपला ना typical autism spectrum presentation झालं की सुरुवातीपासून मुलगा ऐकत नाहीये, लक्ष देत नाहीये. But there are some children where parents say की 3 वर्षापर्यंत छान होता, 2.5 वर्षापर्यंत छान होता, आणि मग आता तो पाठी गेल्यासारखा वाटतो. And we have to think about neuroregression disorders in that, like childhood disintegrative disorders म्हणा, ALDs म्हणा, किंवा Landau-Kleffner म्हणा. And that is another topic and another talk altogether, and I'm not going to focus on that today. So in short, autism screening ideally in all children at 18 months, 24 months, and definitely if there are concerns about communication. Okay, now let's come to the third case. So you have this 18-month-old जे routine vaccination साठी आले आणि आपण सर्वेलन्स केला आणि you see red flags for ASD, आणि मग आपण MChat केलं आणि MChat is now positive. आता काय करा?
I think then we should refer her to a developmental pediatrician for a thorough evaluation, whether he is fitting into autism spectrum disorder or not. And if the symptoms are very strong and very classical, then you can start with occupational therapy and speech therapy. If the developmental pediatrician is going to take some days or weeks to come, then you can start the therapy as early as possible and try to convince whether the parents are getting convinced or not. That is very important, basically.
Perfect. Okay. So, आपलं MChat पॉझिटिव्ह आलं, स्क्रीनिंग टेस्ट पॉझिटिव्ह आलं, तर आता स्क्रीनिंग टेस्टचा गोल काय आहे? इट्स नॉट गोइंग टू प्रिव्हेंट डिसऑर्डर, इट इज नॉट गोइंग टू define the what quality of treatment the parent is going to get, the child is going to get. It only creates an opportunity for us for early treatment. But parents, as Shailesh very rightly said, follow diverse paths. May some get convinced and can go into treatment very quickly, while there are others who will wait and watch. They will try tongue tie surgery, they will try something else, maybe homeopathy or something else. So the important aspect of screening is not actually the screening itself, but what happens after screening. आणि काय झालं पाहिजे, स्क्रीनिंग नंतर असेसमेंट झालं पाहिजे मुलाचं. सो आयडियली काय झालं पाहिजे, वी शुड रेफर फॉर हिअरिंग and we should refer for developmental and autism evaluation. And as Shailesh rightly said, we should simultaneously do parental education about evidence-based intervention and referral. But practically क्या होता है, resource services, all this expertise, as we know, is not available easily. So many families do not understand the reason की आपण assessment का करायचं. त्यांना फक्त काहीतरी ट्रीटमेंट पाहिजे असते to make the child better. This is practical. Culturally आणि social आपली belief system काय, wait and watch, मुलं मोठी होतात तसं हे सगळं डेव्हलप होणार. आणि ह्या सगळ्यामध्ये कॉस्ट आणि जो टाइम डिले असतो, डायग्नोस्टिक असेसमेंट कॅन बी कॉस्टली इन सम प्लेसेस, दे कॉस्ट समली 10,000, 15,000 in some places. So the cost and the time delay, because as you said, it may not be immediately available, so there might be some time delay. All this leads to poor uptake of these services, or it compromises the quality of assessment, and this leads to poor quality of reports. आणि होतं काय, 50% किंवा त्याच्यापेक्षाही जास्त, 50% I have written here, but more than 50% of screen positive who are referred to a developmental pediatrician don't go through further assessment and are lost to follow up. आणि हे आपलं इंडियाचं नाहीये, हे अमेरिका आणि इंग्लंड मध्ये पण हीच स्थिती आहे की बरेच तिथे फक्त काय, बाकीची हेल्थ केअर सिस्टम जी आहे, कम्युनिटी वर्कर्स, हेल्थ विजिटर्स is robust, so they can bring the child back into the system. But ते जर नसेल तर most of them, at least 50%, will get lost to follow up till they turn up 3 years, 2 years later. आणि मध्ये काय होतं, the child suffers. All the well-meaning relatives, neighbors, दूधवाला, भाजीवाला काहीतरी सांगतो की इथे करा, हे करा, होमिओपॅथी करा, हे आपले ऑल्टरनेटिव्ह ट्रीटमेंट्स करण्यात वेळ जातो. So shall I wait after screen? No, because we know की MChat positive म्हणजे 50% ASD, 90% some developmental disorder. So we need to start some treatment. Whether the child starts something, whether the child sees a developmental pediatrician a week later or a month later, at that particular point, when before sending the parent out, something needs to be done. Otherwise, the parent is going to get lost to the system. So it is early intervention and not a diagnostic label which is going to help the child's development. And this, I think we all know this, we are all aware about it, but we need to understand and convince the parent that early intervention really works. 3 वर्षापर्यंत थांबणं, 2 वर्षाला आला तर 3 वर्षापर्यंत थांबणं, 3 वर्षाला आला तर 4 वर्षापर्यंत थांबणं is not a great idea, because the prenatal and the first 3 years postnatal, and this is exactly what you are going to tell the parents, this is the single most transformative period in the whole lifespan for a child's brain development. म्हणजे हे जे न्यूरल सर्किट्स असतात, सिम्पल वरनं हायली कॉम्प्लेक्स सायनॅप्सिस डेव्हलप इन ऑल द एरियाज, आणि मग प्रूनिंग होतं. आणि ऑल दिस is dependent on input from the environment. Okay, so this is neuroplasticity. आपल्याला हे सायन्स माहिती आहे, पण हे पेरेंट्सना हे कळवणं गरजेचं आहे की हे जे आपले नर्व्स असतात ते सगळे स्ट्रॉंग होतात. आणि न्यूरोप्लास्टी म्हणजे काय, तर ब्रेन इज ऑलवेज लर्निंग, but it learns whatever is repeated. Now the young brain does not know what is good, what is bad, what is helpful, what is not helpful. So it will only learn what is given or served to it from the environment. So it is up to the input from the environment that is very important. आणि हे पेरेंट्सना कळलं पाहिजे. ओके, सो वी नीड टू टेल द पेरेंट्स इफ हे ऍट रिस्क जो आहे ऑटिझमचा ऍट रिस्क एमचॅट पॉझिटिव्ह म्हणजे ऍट रिस्क फॉर ऑटिझम, इफ दिस चाइल्ड इज इंटरव्हीन बिफोर द ब्रेन सर्किट इज एस्टॅब्लिश्ड देर इज बेस्ट चान्स ऑफ डेव्हलपमेंटल ऑप्टिमायझेशन. पण ह्याच मुलाला आपण निग्लेक्ट केलं तर प्रॉब्लेम्स 100% असणार आणि हे अगदी ठामपणे मूल पेरेंट्स तिकडे गेलो पाहिजे. And this is what, again, if we lose this time frame, the child is going to suffer. So इथे ना पेरेंट्स असतं ना, पण माझं ना मी 8 वाजता जाते आणि मी रात्री ना 8 वाजता येते आणि आता ना माझा तो बँकिंगचं अकाउंट क्लोजिंग आहे त्यामुळे मी अजिबात काही बघूच शकत नाही. So it is important to counsel regarding prioritizing their child's environment over everything else at this crucial time. Because हा टाइम आपण जर मिस केला तो जगात आयुष्यात पुन्हा कधीही येणार नाही. And all that we are asking from the family is one responsible, committed young adult to be involved heavily in the child. म्हणजे काय? Responsible, committed म्हणजे not a maid, not a babysitter. It has to be a parent who can be more responsible and more committed than a parent. Nobody else in this world. Young adult, because I see so many grandparents bringing their children sitting outside, and they are all well-meaning. They want to help. But there is a limit. So we want a responsible, committed young adult to be involved with the child. Okay, this is all that we want from the family. Now, I don't care whether it's the mother or the father. It can be an aunt, but it should be a family member who is be able to do this. Second thing, and very important thing about parental counseling at this stage is they are focused on बोलतच नाही. They are focused on speech, verbal communication. तोंडातून शब्द. But we know that these children have many pre-speech deficits, which we have to tackle before meaningful conversation or communication starts. And what is pre-speech deficits? It starts right here. Interaction, play, paying attention to others, understanding the language. आणि sound आणि speech हे इथे येतं वरती. म्हणजे आपण हा पाया केल्याशिवाय इथे जाणं is completely wrong. So this is what. And that is why blankly referring, if a child is not speaking without understanding whether all these हे जे आपलं pre-speech deficit झालंय की नाही, हे बघायच्या आधी blankly referring a child to a speech therapist with the wrong expectation of parents and doctors of getting speech out of his mouth is not early intervention and should be avoided. Okay. So what is early intervention? This is something we can talk to the parents. Okay. Screen time, certainly तिथे अडकलेला मुलगा आपल्याकडे लक्ष देणार नाही. So we need to discuss screen time. हे जे इंटरॅक्शन आहे खालचं ते कसं होतं सुरू? आय कॉन्टॅक्ट, ड्रॅमॅटिक फेशियल एक्सप्रेशन्स. मुलाने अर्धा सेकंदासाठी तुम्हाला आय कॉन्टॅक्ट दिला आणि इफ यू गिव्ह अ ड्रॅमॅटिक फेशियल एक्सप्रेशन तर द आय कॉन्टॅक्ट इज गोइंग टू बी मोर सस्टेन्ड. ओके, लॉट ऑफ जेस्चर्स. हळू आवाजात मुलाशी नाही बोलायचं, त्याचं लक्ष वेधून घेण्यासाठी लॉट ऑफ जेस्चर्स, जॉईंट अटेन्शन, इमिटेशन, खेळणं मुलाबरोबर, इंटरॅक्टिव्ह प्ले. आणि ऑल दिस इन्फंट्स लर्न फ्रॉम देअर घरच्या एन्व्हायरमेंट मध्ये अँड द इंटरॅक्शन्स विच आर रूटेड इन अवर एव्हरीडे केअर गिव्हिंग ऍक्टिव्हिटीज. दे, हे जाऊन पप्पाला दे, त्याला कळत नसेल तर हाताने दाखवायचं पप्पाला दे. ह्या ज्या आहे त्याच्या लेवलवरती येऊन बोलायचं. ह्या सगळ्या गोष्टी होणं गरजेचं आहे. आणि स्टॉप, फॉर गुडनेस टेक, स्टॉप टीचिंग दिस एबीसीडी. ओके, 18 महिन्याची मुलं कलर्स ओळखतात आणि एबीसीडी बोलतात आणि मम्मा पप्पा बोलत नाही, हे म्हणजे आपण कुठल्या तरी रॉंग दिशेने चाललेलो. आणि हे करायला कुठलंही डिटेल्ड असेसमेंट, डायग्नोस्टिक लेबल्स लागत नाही. एवढं आपण जर सांगितलं ना तर विदिन 2 weeks or so पेरेंट्स सी चेंज आणि देन दे फील की काहीतरी हे ना बरोबर होतंय, आपण कुठल्या तरी राईट डिरेक्शन मध्ये जातो अँड दे आर मोर ॲमेनेबल टू ते लॉंग टर्म ट्रीटमेंट करायला. आता वेस्टर्न आपल्या इकडे कसं आहे, हा वेस्टर्न वर्ल्ड मध्ये काय होतंय, असेसमेंट प्रोसेस ही अगेन हा फुल डे, सगळे प्रोफेशनल्स इन्व्हॉल्व, ह्यूज लॉंग वेटिंग लिस्ट. त्यांच्याकडे 6 ते 9 महिन्याची वेटिंग लिस्ट असते फॉर असेसमेंट. So there are months before an assessment can happen, but nobody waits for assessment. Intervention is this, exactly this intervention is started by community workers. Okay. Second thing is त्यांच्याकडे assessment साठी जास्त का आपण पाठवत तिथे का असतं द डायग्नोस्टिक लेवल बिकॉज इन्शुरन्स बेस्ड सर्व्हिसेस असतात. आपल्याकडे इन्शुरन्स मध्ये काही मिळत नाही थेरपीला. सो आपल्याकडे वी जस्ट स्टार्ट, वी डोंट नीड अ डायग्नोसिस और अ लेबल टू स्टार्ट एनी ट्रीटमेंट. ओके, ऑलराईट. सो झालं, आपण एमचॅट केलं, आपण अर्ली इंटरव्हेन्शन केलं आणि आपण डेव्हलपमेंटल पिडियाट्रिशियन कडे पाठवलं. म्हणजे साईड बाय साईड ह्या गोष्टी झाल्या पाहिजेत, असेसमेंट झालं पाहिजे, पण मे बी एका महिन्यानंतर ते डेव्हलपमेंटल पिडियाट्रिशियन कडनं परत आले. मग काय करायचं? डू यू वॉन्ट टू टेक इट? Somebody wants to take it?
No.
Okay, let me start. So when the reports come from the developmental pediatrician, that report might be 2 पानाचं किंवा 50 पानाचं, depending on which center you have sent, okay, or which developmental. It is personal. But what is important rather than the quantity of pages is whether the parents have understood the quality or what they have understood from the report. की त्यांना नेमकं करायचंय का? It is not about how many pages, it is about how many, what kind of understanding the parent have come to you with. So you ask them की काय कळलं तुम्हाला, आपण आता काय करतोय. आणि when they say talk about interventions, reinforce the need for interventions and home program in the first visit. Okay. Now in this time parents will have done their Google search and they will have many questions. आणि तुम्हाला आपल्याला थोडेसे questions चे answers माहिती असली पाहिजेत. वन ऑफ द कॉमनेस्ट मी घातलेला आहे वॅक्सिनेशन. सर 18 महिन्याचं वॅक्सिन घेतलं तुमच्याकडे आणि तुम्ही म्हणताय एमचॅट पॉझिटिव्ह आणि हे ऑटिझम म्हणताय, ते वॅक्सिनेशनमुळे तर नाही झालं. सो दिस इज आणि देन दे गो ऑन गुगल आणि दे विल गेट लॉट ऑफ कन्फ्युजिंग डिटेल्स. So I think we need to be very clear that the current evidence shows absolutely no connection between vaccination, whether it is MMR or measles or anything, and autism spectrum disorder. And for this, I mean, just something away from this, की हे जेव्हा प्रकरण झालं होतं वॅक्सिनेशनचं, की MMR चा आणि ऑटिझमचा काही संबंध आहे का? I remember this was something around 1997 का 98 च्या दरम्यान. That time I was in the UK and there is this doctor, he's a gastroenterologist, Dr. Andrew Wakefield. He was आमच्या त्याच काउंटी मध्ये होता. He was there, so he was a Royal London, I was in. So हे जेव्हा निघालं तेव्हा it was a huge news at that time because parents started saying started refusing vaccination. It was covered by newspapers and TV people and there was a huge uproar in the country and people stopped using, stopped giving vaccination. And gradually various studies were done and that showed that there was no connection. It did show that there was a lot of conflict of interest in the first study which was presented by Dr. Wakefield, and in fact he was even barred from the GMC, the General Medical Council of UK at that time. पण झालं काय की ह्या न्यूजला कव्हरेज मिळालं पण ह्या न्यूजला मिळालं नाही, जे त्यात सगळं चांगलं होतं काही नाहीये, त्यामुळे अजूनही ते कुठेतरी निघतं. बट वी नीड टू बी व्हेरी क्लिअर because we need to tell the parents vaccines जेव्हा हे बंद केले 1998-99 मध्ये बऱ्याच पेरेंट्सनी UK मध्ये, तेव्हा ऑटिझमचा रेट कमी नाही झाला पण मिझल्स आणि MMRचा मम्सचा रेट मात्र वाढला. So there was no effect on autism spectrum diagnosis at that time. So I think we have to be very convinced about this and we can reassure the parents. Second thing is children with autism spectrum have a lot of medical comorbidities. म्हणजे ते खात नाहीत बरोबर, ते चावत नाही, त्यामुळे ते कॉन्स्टिपेटेड असतात, मग ते इरिटेबल असतात, मग ते झोपत नाही आणि दे विल कीप ऑन कमिंग टू यू विथ ऑल दिस सिम्पटम्स. सो ह्याच्यामुळे ना तेव्हा त्यांना ना ही प्रायोरिटी अपॉइंटमेंट ठेवणं काइंड ऑफ हेल्प्स द फॅमिली क्वाइट अ लॉट बिकॉज दे आर ॲज इट इज दे आर अटेंडिंग सो मेनी अदर थेरपीज ऑर वॉट एव्हर की त्यांना पहिली किंवा लास्ट म्हणजे हे प्रॅक्टिकल जी हेल्प आपण पेरेंट्सना करू शकतो की पहिली किंवा लास्ट अपॉइंटमेंट द्या सो दॅट द पेरेंट अँड द चाइल्ड डजंट हॅव टू वेट इन द वेटिंग एरिया फॉर टू लॉंग. They will want to discuss some complementary medicines as they go ahead and we'll talk about this in a bit later on, but we really have to keep reinforcing our advice ki non evidence based costly or potentially harmful treatment जे आहेत त्यांच्याकडे आपण जायचं. Any questions till now or shall we take the next case?
Let's go ahead.
Let's go ahead. Okay. So case 4 आपण बघूया. Now, this is a 4-year-old boy who was diagnosed by a specialist as mild autism and global delay. And actually, he came to me for a second opinion. And this is the prescription which he came with. Please comment. Somebody please comment.
It's too much.
Except for the last one, 7 and 8, everything.
7 and 8 are good.
Yeah.
Right. So the family came saying कि मैडम 6 महीने पहले हमारा ये डायग्नोसिस हुआ है और डॉक्टर साहब ने जो भी ट्रीटमेंट बताया हम सब 6 महीने के लिए वेरी रेगुलरली कर रहे हैं. ओके, फिर भी कुछ भी फर्क नहीं पड़ रहा है, तो इसलिए हमको थोड़ा राय लेना था. राइट. So this is where it comes. So here, let's just talk a little bit about the इथे मी काय केलंय हे सगळे पॅरासिटाम 5 ml, कार्नोसिन 5 ml twice daily, omega 3, pyridoxine, calcium, vitamin D. आणि हे ओटी स्पीच थेरपी हे ऍक्च्युअली असं लिहिलं होतं एका लाईन मध्ये, थेरपी डॅश ओटी स्पीच थेरपी स्पेशल एज्युकेटर. आणि मला खरंच माझ्या 25 वर्षापूर्वीची जेव्हा एखादा सेरिब्रल पॉल्सीचा पेशंट असायचा तर आपण लिहायचो ओटी पीटी स्पीच थेरपी सिटी ऑल, त्याची आठवण झाली की बाबा म्हणजे मला तेव्हा काहीच माहित नव्हतं की ओटी काय पीटी काय. तेव्हाची मला ते दिवस आठवले कारण की हे जे दिस इज रिटन बाय अ स्पेशलिस्ट. ओके, सो दिस इज समथिंग विच वी रिअली नीड टू बी aware about. And I'm just very quickly going to talk about evidence-based all these medications in behavioral and developmental disorders. And I'm going to talk about 3 things: omega-3 fatty acids, piracetam, and L-carnosine. This is the most popular nutraceutical, nutritional based pharmacy. And we know that these are essential fatty acids and our body can't make it. So it has to come from diet or medicine. And these are the various omega-3 fatty acids. And ह्याच्यातलं DHA जे आहे ते सगळ्यात important. And it is vital for brain development and retirement. But when we look at the Cochrane reviews, and there are various studies, the omega-3 चे त्यांचे जे dosages वापरले ते 1.3 grams per day, 1.5 grams per day. So twice or thrice or 4 times the thing which we give in 5 ml. And what is there? I want to cut a long story short. There is no significant effect of omega-3 supplements on social interaction, communication, stereotypy, or hyperactivity. So the current data suggests that they do not enhance the performance of children with autism spectrum disorders in ASD or in ADHD and other neurodevelopmental disorders. So there are plenty to suggest this at present. So अजून ते आपल्याकडे evidence काही नाहीये कि it helps in autism. Coming to piracetam, and it will get various brands. These are the different brands that you get. Again, there are very few good studies of piracetam in children. Most of them are for senior citizens. The studies are. And what has been found that it does not enhance, whatever small studies are there, it did not enhance cognition or behavior. Some adverse effects have been noted as irritability. Carnosine, we know it's a protein building block, amino acid naturally found in muscles, heart, brain, and food sources, meat. The rationale for this is that there is some connection between carnosine and brain functioning, which seems to be altered in autism. But so that it is proposed that they have this neuroprotective, antioxidant, anticonvulsive properties that may be beneficial. But the current data that we have does not support the use of L-carnosine in the management of children with autism spectrum disorder. And let us be very clear about that in our head. Personal practice aside, म्हणजे आपण दिलं तर काहीच नाही, but we should know how much it is going to help. So what should we do when parents want to discuss these complementary medications? What is the role of this? So complementary आणि alternative medications हे discuss करणं गरजेचं आहे, कारण आपण जर नाही discuss केलं तर parents will go on the net. There's lots on the net from various supplements to camel milk to swimming with the dolphins and whatnot. Okay, so there is plenty there on the net, and they will want to try because what they have heard is there is no medicine for autism, and they want to try whatever is there. So if they really want to try, we cannot not support. We have to support them. if they are safe and cheap medicines. Okay, but we need to make sure that this does not prevent patients from obtaining evidence based treatment. म्हणजे तुम्ही एव्हिडन्स बेस्ड करा आणि तुम्हाला काय पाहिजे ते करा, हे सोडून ते करायचं नाही आपण. So CAMs or complementary and alternative medications are not a replacement for standard. हे पेरेंट्स पर्यंत गेलंच पाहिजे. आणि वी कॅन ऍडवाइज की ट्राय 1 at a टाइम. आपण 5 नको करूया, 1 करूया, 2 महिने बघूया, मॉनिटर क्लिनिकल रिस्पॉन्स, मॉनिटर साइड इफेक्ट्स, आणि then we can decide whether it is helping the parents, helping the child. So this case, when the parents told me हम लोग सब कर रहे हैं, this is exactly what I asked him कि क्या कर रहे हो बताओ मुझे, थेरेपी में क्या कर रहे हैं. नहीं वो 7 और 8 नहीं किया, वो मैंने first 6 सब कर रहे हैं. So as soon as they get a prescription like that, if I get a prescription like that, my first instinct is की मी डॉक्टरच्या बाहेरून जाणार, डॉक्टरच्या क्लिनिक मधून बाहेर जाणार आणि बाजूच्या केमिस्ट कडनं आधी ही औषधं घेणार. आणि एकदा घरी गेल्यावरती हे आपण ट्राय तरी करून बघूया 2-3 महिने, आणि नंतर बघूया आपण हे थेरपी ओटीपीटी काय जे काय आहे ते. दिस इज द नॉर्मल थिंकिंग ऑफ एनी फॅमिली, राईट? सो काउन्सिलिंग वेन यू आर डुईंग दिस, की ह्याच्यामध्ये सगळ्यात इम्पॉर्टंट काय आहे, आणि व्हॉट क्लबिंग दिस थेरपीज ॲज वन विदाउट एक्सप्लेनिंग, आय डोंट थिंक दॅट्स द राईट थिंग. ओके, so is there, so what, okay, so parents will say okay हम लोग अभी चालू करते हैं therapy. So what is the cost to the child? Is there a cost involved for this? Of course it's a cost of medications. You know, this small bottle of omega-3 costs 1200, and that lasts for what, 15 days, maybe 15-20 days, and that dose is not even the dose which are used in studies, which are 3 times to 4 times the dose. So if you really go to try those higher dose, हे 4 दिवसात संपून जाणार आहे ते 150 ml. ओके, ह्यूज कॉस्ट. आणि वेन वी आर रायटिंग दिस, each one कॉस्ट पहिले 3 they are very costly ones. आणि ते देऊन मग 6 महिन्याने ते येतात ते, अरे सगळे पैसे, मग 6 महिने आय बीन युजिंग 3000-4000 पर मंथ चे मेडिसिन्स. They neither have the time or the money for therapy. Because why don't they have the time? Because हे 5 औषधं दिवसभर देण्यामध्येच त्यांची मारामारी असते, मुलाला घ्यायचं नसतं. It's a fishy smell, the child vomits, but they think this is some brain tonic and this is going to cure the child. So they dedicate themselves and their entire day to give them these medications for months before they realize that there is no improvement happening. So there is a huge cost, not only in monetary time, but mainly the time lost by the child. And as we said, early intervention, early to neuroplasticity मध्ये आपण time waste करू शकत नाही. So are there any medications which are useful? And I'll quickly go through this. I don't think we can discuss this too much. So there are no medications to treat the core symptoms of autism spectrum. The core symptoms are social communication, social behavior, and repetitive movements and restricted play. But those symptoms that interfere with learning, socialization, safety, overall functioning, medications can help. And what it helps is, it helps the child to calm down enough to be able to participate in various behavioral interventions. Okay, so this is important, because if the child is extremely irritable or the child is not sleeping at all, both the child and the parents are exhausted and are not able to do any kind of intervention that we are trying to tell them. So we might need some medications to help improve these behavioral symptoms. And these are some I have listed. But we really need to think about giving each medication and what are we trying to achieve, and go from small dose to high dose. Let's try not to use polypharmacy, because we don't know where side effects end and side effects start. So ADHD आपल्याला माहिती आहे, methylphenidate आणि atomoxetine. There are various aggression and self-injurious behavior which really respond very well to risperidone. The only main side effect is drowsiness and weight gain. And if the child's the dose thoda jast zhala or the child sleeps through the day, then the child is not going to do intervention. So we have to monitor these side effects and go from a very small dose to a higher dose. Aripiprazole also works very well in these maladaptive behaviors. Anxiety is very common in children because they are unable to express themselves and they are expected to do a lot of things which they are unable to do. So they get very anxious. And if there is too much of anxiety and it doesn't settle with interventions, then fluoxetine can help to a certain extent. but the most common one which I have to use is melatonin, because this is very common in children with autism spectrum, the sleep dysfunction. त्यांना झोपायला उशीर होतो, उशिरा झोपतात, जेव्हा झोपतात तेव्हा ते सारखे सारखे उठतात, झोपून झाल्यावरती वर लगेच फार लवकर उठतात आणि दिवसा झोपत नाहीत, आणि त्यामुळे पूर्ण फॅमिली स्टेज अवेक विथ द चाइल्ड, आणि द होल सिस्टम becomes very difficult until and unless we target sleep first. So lot of times बाकीचे बिहेवियर्स बाजूला ठेवून स्लीप आणि फीडिंग हे दोन गोष्टी आहेत जे पेरेंट्सना खूप त्रास देतं आणि खूप कॉमन त्यांचा प्रिव्हिलन्स आहे, आणि वी कॅन हेल्प देम विथ दिस. मोस्ट फॅमिलीज आर व्हेरी ग्रेटफुल because then they get that peace of mind to start working on the child. So to summarize, let us ensure that parents understand that good quality and quantity of multidisciplinary training with parental involvement forms the mainstay of management in most neurodevelopmental and neurobehavioral disorders. But medications, when used appropriately, helps the child and family to participate better in the therapy programs and hence improves the outcome. I think this is the last case. So this is a 5-year-old child who was diagnosed at 3 years with autism spectrum disorder. आपण सगळं केलं, MChat केलं, डेव्हलपमेंटल पीडियाट्रिशियन कडे पाठवला, तो परत आला, रिपोर्ट मध्ये म्हटलं ऑटिझम स्पेक्ट्रम डिसऑर्डर. Then he goes away for 2 years and he has been on occupational therapy, and he comes back 2 years later. He has been on occupational therapy, speech therapy, special education and behavioral therapy, he tells you, for the last 2 years. And parents say that yes, he can name colors and shapes and alphabets and numbers, but he's still hyperactive and he's still very difficult to manage. मग आपण काय करायचं? Anybody?
Here some medications may help. So perhaps, yeah, but he's just 5 years old. 5 years is too early to start medication for ADHD. So there are still some non-pharmaceutical things that can be done for hyperactivity. That is, one is to increase physical activity outside of home and to reduce the amount of sugar consumed by the child. So these are some non-pharmaceutical things that can be tried.
Correct. Okay. So Atana, hey, this is a very common case.
You have to reinvestigate revisit your diagnosis, whether it is really autism spectrum disorder. Here, I have not seen a developmental pediatrician has seen this child or not. That we have not seen.
Actually, काय झालंय, 3 वर्षाला तुम्ही पाठवलं, आपण पाठवलं MChat पॉझिटिव्ह, डेव्हलपमेंटल पीडियाट्रिशियनचा रिपोर्ट आला की द चाइल्ड नीड्स इंटरव्हेन्शन्स, दिस इज ऑटिझम स्पेक्ट्रम डिसऑर्डर. मग ते 2 वर्ष आपल्याकडे आले नाहीत, पण ते कम बॅक नाव की चाइल्ड हॅज बीन OT, स्पीच, स्पेशल एज्युकेशन, बिहेवियरल थेरपी चालू आहे. नॉट नेसेसरीली विथ द डेव्हलपमेंटल पीडियाट्रिशियन वेअर यू हॅड सेंट, इट माइट बी वेरेवर. आणि अजूनही प्रॉब्लेम्स तसे आहेत, पण इम्प्रुव्हमेंट आहे. ती कलर्स ओळखतोय, शेप्स ओळखतोय, अल्फाबेट्स करतोय, नंबर्स करतोय.
We have to continue the same and I think modify.
2 वर्ष जर ते करून उपयोग नाही झाला तर कंटिन्यू सेम तर काय उपयोग होणार नाही, राईट?
You have to change the therapy part of it.
Right.
We have to find out some comorbidity associated, because many of these children of autism do have associated comorbidities. So that also has to be.
Yes, absolutely. So there are a lot of things which we need to do in this child. आणि whatever you all have said is right. पण पहिल्यांदा आपण सुरुवातीपासून करूया ना, ती थेरपी आपली जी चालली आहे ती काय चाललंय, पेरेंट्स काय करतायत, ह्या सगळ्या गोष्टीकडे थोडं लक्ष देणं गरजेचं आहे. ओके, सो लेट अस डिस्कस नेक्स्ट फ्यू मिनिट्स अबाउट व्हॉट वी कॅन आस्क and what I feel should be happening and what is actually happening. So when, see, autism spectrum disorder is like this, की जे आपण म्हणतो ना, ब्लाइंड मॅन आणि एलिफंट, एकाने सोंड पकडली, ते तो सापच आहे, हा हे रोप आहे, हे झाड आहे, हे प्रत्येक जण जे डोळे बंद करून जेव्हा आपण हे करतो तेव्हा प्रत्येक जण आपल्या दृष्टिकोनातून बघतो. ओके, आणि बऱ्याचदा तसं होऊ शकतं किंवा होण्याची शक्यता असते की हे जे ऑक्युपेशनल थेरपी माइट लुक ॲट इट फ्रॉम द सेन्सरी प्रोसेसिंग डिसऑर्डर पॉइंट ऑफ व्ह्यू, A psychologist might look at it from another point of view. A speech therapist might look at it from another point of view. आणि हा जो इंटिग्रेशन झालं पाहिजे की somebody looks at the whole child may or may not be happy. सो हे पीस मिल जेव्हा होतं, जेव्हा त्या थेरपीचं इंटिग्रेशन होत नाही, तेव्हा प्रत्येक जण बऱ्याचदा प्रत्येक सेशन्स मध्ये काहीतरी होतंय, पण नेमकं काय होतंय ह्याचा एक आपल्याला निष्कर्ष लागत नाही. आणि आय मीन आय जस्ट see, I think I know so many therapists and they are extremely hardworking therapists. They are extremely well educated therapists. But सगळीकडे ते होत नाही. And we need to be aware about the quality of that, just like any profession. Not all therapists can give quality. Not all therapists can give what we want for the child wants. So I think we need to be first starting from that point, and we need to revisit diagnosis, look at comorbidities. But first try to understand ki 2 वर्ष जे काही झालं ते is that satisfactory or not satisfactory. Okay, so you really need to stand away and look at the whole child and ask the parents, okay, so 2 वर्ष तुम्ही काय करताय? Can you show me some reports or some assessments or some goals or something where I can see ki तुम्ही पुढे चाललाय, तुम्ही काय करताय? Okay, the parents may or may not have that and you can go through that. But let me just talk a little bit about autism therapy म्हणजे काय. Okay, and there are various approaches for autism therapy. And first thing is, and the most common approach or used for many years is this behavioral therapy. This is the most common, most popular, most researched approach in autism spectrum, and one of the most commonly used in Western countries, especially in America. Second one, a fairly recent, not very recent, but fairly recent, is a developmental and relationship approach. हे 2 main approaches झाले. आणि तिसरं मग आपलं आलं speech therapy, social skills, sensory integration, educational model. Okay, and there are many under this other therapies. So all these autism spectrum disorder programs, they all of them have a lot of overlap. So it is not very easy to define की ही category, ही activity ह्याच्यामध्ये झाली पाहिजे किंवा त्याच्यामध्ये झाली पाहिजे. आणि to be honest, there is no global consensus की कोणता intervention program is the most effective. Okay, so there is no global interest. So that is why there is so much confusion, right? So let's just quickly go through what each means, because when a parent tells you that मी माझं behavioral therapy चाललंय किंवा माझं मी DIR करतोय, my therapist is doing DIR with me, what does that mean? Is at least some idea as a pediatrician we should have. Okay, so behavioral therapies are आपले जे the ABC of behavior, antecedent, behavior आणि consequence, ह्या ह्याच्यावरती अवलंबून जे थेरपीज आहेत त्याला आपण behavioral therapy. And there are 2 main types. One is DTT and other is NET. So what is DTT? It's discrete trial treatment. आता ह्याच्यामध्ये काय असतं, and this has been going on for years in America. This is a structured program where repeated discrete trials to teach small sub skills are happening in simplified steps. म्हणजे काय, मला जर त्या मुलाला खायला शिकवायचं असेल चमच्यात, तर चमचा उचलणं, त्याच्यानंतर ते तोंडाकडे घेणं, मग ते घालणं, मग ते चावणं, चमचा खाली ठेवणं, हा प्रत्येक पूर्ण स्टेपला it has to be divided into smaller steps. Okay, and then that if we just take one की ह्या मुलांनी चमचा उचलला पाहिजे हाताने, त्याला आपण मग ते 3 पार्ट्स मध्ये की आपण एक क्लिअर इन्स्ट्रक्शन देतो, पिक द स्पून किंवा चमचा उचल. त्या आपण एक्सपेक्ट करतो की मुलांनी तो चमचा उचलावा, हातात पकडावा आणि उचलावा, आणि ऍज अ कॉन्सिक्वेन्स यू कॅन गिव्ह हिम सम रिवॉर्ड. Okay, and that reward can be, if he likes to play with the car, you can give him the car to play for 30 seconds. Okay, or you the wrong reward is actually food, where people keep giving chocolates or small Cadbury. So अशा प्रकारे हे discrete trials small sub skills से करत राहतो आणि हे repeatedly करतो, आणि this repeated practice helps master. That is the idea or the principle of this therapy. So if it is a highly structured, म्हणजे आपण भाषा बदलत नाही, पिक स्पून म्हणजे पिक स्पून, कम ऑन पिक अप द स्पून नाही, पिक स्पून, चमचा उचल, चमचा उचल, असं सारखं 40, 50, 60, 100 वेळा बोलल्यावरती जेव्हा ती मास्टरी येते की मुलगा चमचा उचलतो, मग आपण त्याच्या पुढच्या स्टेपमध्ये की त्यांनी स्कूप केलं पाहिजे. ओके, सो दिस consistent repetition. There is language remains the same word, so there is no confusion for a child on the autism spectrum is the principle. So these are short starts with obvious start and finish, अगदी क्विक असतात आणि रिएन्फोर्स केली जातात थ्रू रिवर्स. याचं डिसएडव्हान्टेज काय आहे की ते एवढे रोबोटिक होतात की ते सारखं चमचा उचल, चमचा उचल. It becomes so boring, it is so unnatural and it is over structured. आणि इट इज प्रॉम्प्ट डिपेंडन्सी, म्हणजे चमचा उचल म्हटल्याशिवाय तो उचलणारच नाही. 4 चमचे जर ठेवले असेल, चमचा उचल म्हटल्याशिवाय खायचं जरी असेल तरी चमचा उचल म्हटल्यावरच तो खाणार. ओके, सो दिस इज वेअर इट इज बिकम्स जनरलायझेशन बिकम्स डिफिकल्ट आणि इट इज व्हेरी लेबर इंटेन्सिव्ह. आपण म्हणतात की 3 तास तरी रोज आपण हे करत राहायचं, छोटे छोटे स्किल्स, आणि मग आपण दुसऱ्या स्किलकडे जायचं. Next one is this natural environment training. This is again a behavioral therapy, but more natural than the DTT. The DTT is a far structured ahe. This is less structured. It looks like typical interactions, and ह्याच्यामध्ये family involvement is needed. So what happens is it helps generalization. So इथे कसं you set up situations where the child will be motivated. So you keep the toy out of reach, wait for the child to initiate. त्याला जर माहित नाही की त्याला कसं बोलायचं, तो यू कॅन से हात पुढे कर, prompt the correct behavior, give the toy. So the toy itself is a reward. So your reinforcements are natural. So you wait for the child to initiate. If the child doesn't initiate, you prompt and reinforce. Okay, so this is a more natural way of a behavioral therapy. But the disadvantage काय आहे, you have to wait for the child's initiation, आणि ते बऱ्याचदा नसतं, इंटरनल मोटिवेशन नसेल, the child may not initiate often. मग प्रॅक्टिस ट्रायल्स कुठून होणार? सो देर आर दिस दोन वेगळ्या टोकं की अगदी स्ट्रक्चर्ड आणि अगदी अनस्ट्रक्चर्ड. आणि व्हॉट इज आयडियल इज अ मिक्स ऑफ दिस. सो DTT आणि NETचं मिक्स इज अ बेटर वे ऑफ बिहेवियरल थेरपी. नाउ व्हॉट एव्हर बिहेवियरल थेरपी और थेरपी जे आपण बघतो, सो वी नीड टू फाइंड आउट ही जी बिहेवियरल थेरपी चालू आहे हे काय चालू आहे. इज इट व्हेरी स्ट्रक्चर्ड, इज इट व्हेरी रेपिटेटिव्ह, इज इट व्हेरी रोबोटिक, what is actually happening, and ask for the videos from the home where the parent is doing the behavioral therapy, because that will show you what is happening in real life. Okay, the next one is this developmental approach. Now because we know that the emotional and the relationship aspect is the core deficit, what is thought that आपण ह्याच्यावरती काम, बाकी सगळं नंतर करूया, आधी ह्याच्यावरती काम करूया आणि मग पुढे जाऊया. So here you have to use the parent as the actual teacher, and the trained clinicians monitor the program. And there are various programs. This is called DIR, Sunrise program, RDI relationship. हे बरेच programs आहेत. DIR is quite popular. Sunrise used to be quite popular in UK. RDI is again becoming popular in India. I won't talk about all of them. And actually I had a lot of videos for this, but because हे ना YouTube वरती जात आहे ना, त्यामुळे I am not able, I don't have the consent for those videos for YouTube. So that is why I'm not putting the YouTube videos. But when we have, I'm not putting videos, but when we have, if we have a physical meeting, these videos give you an idea how ABA will differ from a developmental therapy. So here in this floor time, actually parent gets down on the floor with the child to play and interact at their level. So it is a play-based model. काही शिकवायला जायचं नाही, आपण खेळायचं. It is playful but purposeful. So child's motivation but adult ह्याचे. So त्यांना जर कलर शिकवायचे किंवा त्यांना जर शिकवायचं की ह्याला बॉल म्हणतात, तर थ्रू प्ले, सो यू फर्स्ट जॉईन इन द चाइल्ड्स प्ले अँड देन गेट युअर थिंग्स डन फ्रॉम द चाइल्ड. आणि इथे पेरेंटल ट्रेनिंग इज अ मस्ट. Now what I have seen unfortunately in some places, ki though this is a beautiful program and it is very popular in US, their parents are trained to do this DIR. But आपल्या इकडे बऱ्याच ठिकाणी मी काय बघितलंय, again parents are sitting outside and parents say ki DIR is happening inside and there is no connection. So on paper it is DIR, but how can it be DIR when parents are not trained at all? So I think again going into what is actually happening in the therapy sessions, is the crux to know whether therapy is what we are thinking should be happening is actually happening or not. आणि ह्याचा फायदा काय आहे की ना हे ओपन एंडेड इंटरॅक्शन ह्या सगळ्या गोष्टीवरती ते काम. When we come to occupational therapy, so in US it is mainly this relationship, त्यांचा प्रोग्रामला ते relationship program किंवा behavioral therapy program असं असतं. Occupational therapy has certain indications. So occupational therapists, they work in different areas of the child's weak points. And they should be really, because children on the autism spectrum have a lot of sensory processing issues. Sensory integration therapy forms a huge part of occupational therapy. Though anybody else also who's trained in sensory integration therapy can also be a part of the program. Do you want me to talk about sensory integration, or I think it's most people know what it is?
We have lots of occupational therapists on the group today.
Okay, so maybe they might be able to answer better because I'm not trained. पण थोडक्यात pediatricianला काय माहिती असलं पाहिजे की सेन्सरी इंटिग्रेशन थेरपी म्हणजे सेन्सरी म्हणजे काय, आपले ते 5 सेन्सेस आणि अजून 2 एक्स्ट्रा वेस्टिब्युलर आणि प्रोप्रियोसेप्टिव्ह. तर ह्याचा कुठेतरी गोंधळ होतो आणि ते जे इनपुट असतात ते मॉड्युलेट व्यवस्थित होत नाहीत आणि त्यामुळे मुलाच्या व्हेरियस बिहेवियरल पॅटर्न्स असतात. दिस इज इनफ. सो सम चिल्ड्रन माइट बी ओव्हर सेन्सिटिव्ह ऑर अंडर सेन्सिटिव्ह. सो आपण जेव्हा MD करत होतो ना तेव्हा आपलं हे सेन्सरी सिस्टीम झालंच नव्हतं जास्त सेन्सरी इंटिग्रेशन. We never knew anything about this sensory integration. What we knew about was the muscular system, hypertonia and hypotonia. We are very good at that. But sensory मध्ये पण hyper responsive आणि hypo responsive असतं आणि त्याचा त्या मुलाच्या attention वरती, behavior वरती फरक पडतो. This is something which we have to understand. And there is a good checklist and there are various symptoms which a child will show, where usually what happens is when the child goes to the occupational therapist or a sensory integrational therapist, they usually do a sensory profile of the child to see whether what symptoms are there and whether the child is hypo or hyper in different sensory areas. आणि मग त्याच्याप्रमाणे कस्टम मेड थेरपी केली जाते. सो एखादा मुलगा हायपोसेन्सिटिव्ह असेल तर त्याला ही ऍक्टिव्हिटी, पण सगळ्यांनाच ती ऍक्टिव्हिटी होणार. डिपेंडिंग ऑन द चाइल्ड्स सेन्सरी नीड्स, the child's therapy activities will be different. So everybody will not have ball bouncing or everybody will not have swing. Some might be undersensitive, oversensitive and might cause problems. So this is something which we need to understand and be aware of. The other thing which occupational therapists work on is the activities of daily living. And this is important because feeding, eating, sleeping, eating, undressing, toileting, ह्याच्यासाठी जे अटेन्शन आणि लागतं, दिस इज व्हॉट इज गोइंग टू हेल्प द पेरेंट्स अँड द चाइल्ड इन द लॉंग. आणि द अदर एरियाज आर हँड आय कोऑर्डिनेशन आणि प्री अकॅडमिक्स. ओके, सो हँड आय कोऑर्डिनेशन मग फाईन मोटरचे जे ऍक्टिव्हिटीज असतात मग ते प्री अकॅडमिक्सला पण तेच यूज होतात. आपले क्लिप्स म्हणा, पेग्स घालणं म्हणा, ह्या सगळ्या गोष्टींवरती हे दीज आर द 4 मेन अँड देर माइट बी मेनी अदर एरियाज, बट दीज आर द 4 मेन एरियाज वेअर अन ऑक्युपेशनल थेरपिस्ट कॅन हेल्प अ चाइल्ड विथ डेव्हलपमेंटल प्रॉब्लेम्स. Let's come to communication therapy. Now, speech therapy आपण म्हणत नाही ऑटिझम, आपण म्हणतो कम्युनिकेशन थेरपी. कारण कम्युनिकेशन आयडियली आपल्याला स्पीच आणि लँग्वेज मध्ये पाहिजे. बट इन अ चाइल्ड विथ ऑटिझम इन एनी पॉसिबल वे, डिपेंडिंग अपॉन द चाइल्ड्स लेवल ऑफ सिव्हिअरिटी. बिकॉज अवर गोल इज सम काइंड ऑफ इफेक्टिव्ह कम्युनिकेशन झालं पाहिजे. बिकॉज इफेक्टिव्ह कम्युनिकेशन विल रिड्यूस मेनी बिहेवियरल इश्यूज. Most of the behavioral issues, irritability, self-hitting, hitting others, getting attention, pulling, pushing, may not be because of sensory problem. It might be because the child is unable to communicate the child's needs to you. Okay? And ithe me, I'm just going to take one short detour. There is what is called as theory of mind, and some of you might be aware of theory of mind. And what it is, so theory of mind is reduced or absent in children with autism spectrum disorder. म्हणजे काय? Theory of mind म्हणजे माझा, if I have theory of mind present, that means I know that whatever is happening is going on in my mind and whatever is going on in your mind is different. I know, I'm aware that my mind is different from your mind. Okay? Now children on the autism spectrum, theory of mind is affected. So what happens is they are unaware that my mind, if I have autism, my mind is different from my mother's. So if I am hungry, I don't have to communicate to the mother. She should understand, because if I feel hunger, she should also feel hunger, because they feel the mind that the mother can feel the same thing. So the intent to communicate for needs is less, because they expect the समोरचा जो माणूस आहे त्याला कळलं पाहिजे की मला काय प्रॉब्लेम. ओके. आणि हाऊ डज इट अफेक्ट अदरवाईज, की सपोज मुलं खेळतात, एखादा मुलगा पडला आणि त्याला खूप रक्त आलं आणि तो रडायला लागला, तर ह्या मुलाला वाटतं की मला तर नाही लागलंय, मला म्हणजे मला दुखत नाहीये, तो हा रडतोय, ते एम्पथी कनेक्ट होत नाही. Because I am fine, I am not feeling pain, I am happy, he might start clapping or smiling or laughing while the other child is crying. And that causes a lot of issues as a child or child is growing up. Because that empathy from us comes when I know that I am trying to tell this parent, the child has autism spectrum, I have empathy, I understand, I am able to modulate की तिला जसं वाटतंय त्याच्याप्रमाणे मी जरा भाषा बदलून बोलणार. पण if I am not feeling bad that the child has autism spectrum and I just say in that way, then there's a problem. So communication जे आहे हे इफेक्टिव्ह कम्युनिकेशन ऑटिझम स्पेक्ट्रमच्या मुलांमध्ये बऱ्याच गोष्टींमुळे त्याच्यावरती बिहेव्हिअरल इश्यूज येतात आणि ते टार्गेट करणं फार गरजेचं असतं. सो कम्युनिकेशन मध्ये ऑफकोर्स अ कम्युनिकेशन थेरपिस्ट विल वर्क ऑन रिसेप्टिव्ह आणि एक्सप्रेसिव्ह लँग्वेज, but more important than that is using language in daily life. This is the important thing. Okay. So when parents come to you and you ask him ki okay त्याला ABCD येतं, पण त्याला जर पाहिजे असेल काही तर तो मागतो का, त्याला जर if you show him fruits, he can identify all 50 fruits, 20 vegetables, okay, 30 animals. But if he wants water or if he wants that fruit banana, will he come and ask you banana de mano, okay, or will he point towards the real banana? So that sometimes doesn't happen because the focus is all wrong. The focus is on academic and pictures, and this is an academic focus and not a language based focus. So we want word, speech, language to be taught which is useful in daily life. म्हणजे किती मुलं येतात की ते म्हणतात झेब्रा, hippopotamus, rhinoceros, they keep on naming animals, but they are not saying mama and papa. तर ते rhinoceros बघणार का मम्मा पप्पाला रोज बघणार? So what should he know? What should we be teaching him? What did we say? That whatever is repeated, the child is going to learn. If in therapy, again, as I said, and as they are all very good friends and colleagues of mine, many therapists, they are very, very devoted and dedicated. But you do find that there are some therapists where the focus becomes wrong, or the parents want a different focus because they want चार फळं आली पाहिजेत, ओळखता आली पाहिजे. They get very happy and they start focusing on apple and watermelon आणि custard apple आणि there is one child who knows the difference between chimpanzee, gorilla, monkey. Okay, त्याच्या पेरेंट्सला पण येत नाही, but this child will be able to tell you. So this is the where we have to teach about दे, घे, दे, मम्मी, पप्पा, नको, टाटा, ह्या वर्ड्स आणि जेस्चर्स वरती फोकस झाला पाहिजे स्पीच आणि लँग्वेज. दिस इज व्हॉट यू नीड टू आस्क when they come. What has been working? What are you working on? Now using, the goal of the therapist is actually not just using some form of communication. It can be speech, but in severe children where there is no speech and language and they are non-verbal, like this child was, at 5 years, he's not non-verbal, but he's not using words. So communication in some form in a non-verbal child, we need to start. So 4 आणि 5 वर्ष झाली आणि एकही शब्द येत नाहीये, but we want to give some child some way of communication, and this is where AAC comes in. This is called alternative and augmentative communication, and it can be low tech, high tech, and there are various these communication. This is one we had made for a child. मग त्याच्या आईचा फोटो, डॅडीचा फोटो, त्याचं ते मॅगी, त्याचं राईस, त्याचा सोफा, त्याची गाडी, ओके, ह्यांचे फोटोज लावून इफ द चाइल्ड वॉन्ट्स वॉटर, ही कॅन doesn't have to show, he will just point, because identification झालेलं असेल तर हे पॉइंटिंग येतं. कारण ऑटिझम स्पेक्ट्रम डिसऑर्डर्स आर व्हिज्युअल लर्नर्स. सो पिक्चर्स ना ते पिकअप करतात आणि दे आर एबल टू शो द मदर की मला हे पाहिजे, और मदर वॉन्ट्स हिम टू गो अँड सिट ऑन द सोफा, मदर विल पॉइंट टू दिस सोफा पिक्चर आणि से की इथे बस, गो सिट, राईट. तो सोफा कळत नसेल, बट द पिक्चर ही नोज. सो वेरियस कम्युनिकेशन बोर्ड्स आर युज्ड various picture exchange system coming. This is called PEX, which is very popular again. There are various apps now. So there are various high-tech app. India's app आहे चपाती डाळ राईस वाला आवाज नाव आहे ह्याचं, and it is used for some communication communication. आणि मग सोशल स्किल्स ग्रुप असतात. आणि ह्यांचा प्रॉब्लेम काय आहे? सोशल कम्युनिकेशन, सोशल स्किल इंटरॅक्शन. सो ह्याच्यामध्ये ग्रुप थेरपीज कम, where occupational therapy might have a group occupational therapy session where there is sharing, turn taking, paying attention. Those activities are worked on. Speech and language therapists might have a group session where again having conversation, understanding non-verbal cues, all these things can be worked on. All these are evidence based. And then this is this very important model, what is called as a teach model. This is an educational model for children with autism. And it is based की त्यांचं strength आहे ना visual information आणि processing मध्ये असतं. So here if you teach them, if they are unable to learn through till they are able to learn through language, we should teach them through their visuals. Okay, so ह्याच्यात हे अशा प्रकारचं ते visual structure असतं where there are various pictures and through pictures bathroom नंतर कपडे नंतर शाळा असे जे पिक्चर्स लावतो सिक्वेन्स मुलांना कळतो. प्रत्येक वेळेस आपल्याला सांगायला लागत नाही. एकदा टीच केल्यावरती मुलांना तो सिक्वेन्स फिनिश स्टार्ट हे सगळं आपण ह्याच्याने करू शकतो. ह्याला खूप मेहनत लागते. दिस इज नॉट इझी बट अँड दिस इज हाऊ इट इज डन इन द वेस्टर्न कंट्री. आपल्या इकडे पण करतो आपण, पण हे झालं पाहिजे. सो वेन दिस चाइल्ड ऑफ 5 years कम्स टू यू, फर्स्ट फाइंड आउट व्हॉट इज हॅपनिंग फॉर द लास्ट 2 years. Before we jump to and we might need medication because unless he calms down, आपण नाही हे करू शकत. But that is later on. First, let's find out I've just put a few session. म्हणजे माझ्या सेंटरचे जे काही एक सेशनचं मध्ये अशा प्रकारे ते सोशल स्किल्स साठी एनकरेज अभीर टू वेव बाय when daddy leaves for work. प्रत्येक ना ब्रेकडाऊन असतं. when अभीर is playing with blocks, take one, give him one. So प्रत्येक कसं करायचं हे एक्झॅक्टली पेरेंट्सला दाखवलं जातं आणि सांगितलं जातं. आणि देन इट गो सेशन 1, सेशन 2, सेशन इट्स ऑल डॉक्युमेंटेड. इट हॅज टू बी डॉक्युमेंटेड बिकॉज अदरवाइज यू डू नॉट नो. पेरेंट्स विसरून जातात. त्यांना 10 गोष्टी सांगतात थेरपिस्ट विल टेल देम 10 थिंग्स बट अ पेरेंट्स रिमेंबर 6 अँड द चाइल्ड एंड्स अप डुईंग 2. सो 10चे 2 व्हायला वेळ लागत. सो आय थिंक डॉक्युमेंटेशन इज रिअली इम्पॉर्टंट. अँड अगेन दिस इज वन ऑफ द स्पीच अँड लँग्वेज थेरपिस्टचं गोल्स आणि देन हाऊ टू go about the activity. So all this has to be there for children whom you are sending for therapy, and they need to come back with that. It doesn't have to be typed, it doesn't have to be many pages, it can be a notebook, but it should be some documentation should be there. So interventions quality and quantity is really important. The quality depends on what the therapist is teaching the parents, and the quantity is the home program, how much the parents are practicing. It has to be individualized. प्रत्येक मुलाचं वेगळं असणार आहे. एक ओव्हर सेन्सिटिव्ह असणार आहे वेस्टिब्युलर साठी, एक अंडर सेन्सिटिव्ह असणार आहे. इट हॅज टू बी स्ट्रक्चर्ड की त्याचं हे झाल्यावरती आपण ते करायचंय. इट हॅज टू बी एव्हिडन्स बेस्ड, इट हॅज टू बी डॉक्युमेंटेड अँड देर हॅज टू बी अ होम प्रोग्राम. दिस इज द रेकमेंडेड 25 hours per week. हे काय थेरपिस्ट कडे होणार नाही, हे घरी होणार आहे. ऍटलीस्ट 2 hours to 3 hours per day हॅज टू बी. And the work has to be on this: attention, imitation, communication, play, social interaction. So whatever, say for example, an occupational therapist is doing sensory processing wise, but finally आपला हा goal हे वाढवणं. Okay, so the goal आपले जे आहे ते attention आणि imitation वाढवणं आहे, and that should, and family involvement is a must. And this again, this is just something which we did the last Sunday in our center. With our parents. This is functional fab workshop. It is functional analysis of behavior. So children with autism spectrum disorder who is hyperactive, aggressive behavior can be because of sensory, it can be because of communication problem, it can be medical problems, how to identify. So we did a parents workshop last Sunday, and it was really very helpful. And it is important की असे जे ग्रुप वर्कशॉप्स त्याच्यामध्ये आपण प्रिन्सिपल्स शिकवू पेरेंट्सना आणि मग इंडिव्हिज्युअली काम करू. So in summary, early intervention, addressing core areas, generalization and functional use of learned skills is vital. म्हणजे जनरलायझेशन म्हणजे काय? डोळा म्हणजे हाच एक डोळा नाही, टेडीबेअरचा पण डोळाच, आईचा पण डोळाच, त्याला जनरलायझेशन म्हणतो. डॉक्युमेंटेशन इज इम्पॉर्टंट आणि पेरेंटल इन्व्हॉल्वमेंट इज व्हायटल. क्लोज डोअर पॉलिसी जी थेरपीमध्ये असते ती अवॉइड झाली पाहिजे. पेरेंट्स शुड बी इन्व्हॉल्ड इन थेरपी. Qualifications and experience of therapists involved should be checked, because I have found that there are quite a few diploma holding who should be working as a assistant to therapist can sometimes doing their own thing. आणि ते कसं आहे ना, वेल काय म्हणतात त्याला, वेल intentioned but not well informed. Okay, and let's be aware about the latest evidence-based treatments. So early prognosis depends on two things: intrinsic and extrinsic factors, nature and nurture, epigenetics and genetics. म्हणजे हे सगळ्याचा मारा होऊन तो प्रोग्नोसिस होतो. आणि हे सगळे जे फॅक्टर्स आहेत, IQ, कोमॉर्बिड, आर ऑल इंट्रिन्सिक फॅक्टर्स. त्याचं आपण काहीही करू शकत नाही. आपण अर्ली आयडेंटिफाय करू शकतो, फॅमिली इन्व्हॉल्व करू शकतो, स्कूल सपोर्ट करू शकतो आणि कम्युनिटी सपोर्ट करू शकतो. आपल्या हातात जे आहे ते आपण करूया आणि दिस विल इम्प्रूव्ह. I'm just going to put, I know I have only few minutes left. I'm just going to put this because the theme of this year is inclusion. आणि आम्ही एक ऑटिझम रन केला होता मागच्या आठवड्यात, ज्याच्यामध्ये चिल्ड्रन ऑन द स्पेक्ट्रम वेअर देअर. And this youth is actually working in our branch. He has autism spectrum. You may not be able to hear it, but just go through it.
नौकरी लगा है, अभी एक्सिस में काम करके भी 3 साल हो गया. मेरा नाम आदित्य अय्यर है. मैं एक्सिस बैंक नवंबर 2018 से ज्वाइन किया है और अभी 3 साल हो गए एक्सिस बैंक में काम करके. अपना एक्सपीरियंस बता ना बैंक में जॉब करने का. बैंक में सब अच्छा ठीक ठाक चल रहा है, इतना प्रॉब्लम नहीं है, काम कर पा रहा हूँ.
क्या करते हो बैंक में?
MIS बनाता हूँ. MIS
सुपर.
क्या
Okay, so that was that he's working in a bank. He's on the autism spectrum. That is inclusion. That is true inclusion. This is a mother of a child. Again, he's 23 years old, and this mother just, I think, I know I'm running out of
He has completed his MCA. It's final semester now, and he scored very good. And now he is working in a small finance bank as an intern. And I'm very happy and proud to be his mother. He has always made me proud. I'm blessed to have him. And he's coping it well. क्योंकि अभी उसने मुझे बोला, when I was crying when he was leaving, he said, "मम्मी बच्चे independent होते हैं जब बड़े हो जाते हैं, so don't cry."
Okay, so I think this is real inclusion, and this is the absolute last slide and the most important slide of the entire presentation. Acceptance of a diagnosis. It's a process. जेव्हा आपण म्हणतो autism spectrum disorder, like any other grief cycle, they go through, the family goes through this roller coaster ride, which starts with shock, denial ki ho's nahi shakat, goes to anger, angry with therapist, parents, developmental pediatrician, maybe angry with each other, angry with themselves because they did not take help earlier. Then they go to bargaining, where they to reach out to others, trying to find meaning, may get overwhelmed and into depression before they start accepting the diagnosis and moving on. And this is where real work starts. आणि डिनायल टू एक्सेप्टन्स हा जो जर्नी आहे प्रत्येकाचा वेगळा असतो, प्रत्येक फॅमिलीचा वेगळा असतो, प्रत्येक फॅमिली मेंबरचा वेगळा असतो. सो द फादर माइट बी इन डिनायल, द मदर माइट बी इन डिप्रेशन, और mother might be in acceptance, father might be in angry, or grandparents might be in denial and parents are here. So it is really important to give right information, communication, emotional support, guidance and direction by us in this process. Thank you very much.
Thank you, Lina, for excellent presentation. There are few questions for you.
Okay.
One question is from Dr. Mahendra Patel. How common is Fragile X and how to proceed?
Okay, so Fragile X is fairly common. It's one of the most common cause of autism spectrum in males. आणि ते diagnosis वेगळं, ट्रीटमेंट आपली depends on what the symptoms are. म्हणजे ऑटिझम स्पेक्ट्रमचं आपल्याला ऑटिझम स्पेक्ट्रम सारखंच करायचंय, पण त्याचं जे प्रोग्नोसिस आहे की बाबा ह्या मुलाचं पुढे जाऊन काय होईल, किंवा त्याच्या पुढच्या फॅमिलीचं काय होईल, किंवा जेनेटिक काउन्सिलिंग, that is where the difference comes. Okay, so we know, and there is Fragile X support group asto. So again, helping the parents meet each other, all this is important and helpful when you get a diagnosis of a syndrome, because prognostication becomes a little bit easier. Parents read up and they know what to expect in the journey.
There was one question from Dr. Kamini Udeshi. Does the GF and CF diet can be of recommendation? That is, I think, gluten-free and...
Correct. No, so it is not an evidence-based diet. म्हणजे there is no evidence that it helps in all children of autism spectrum disorder. But there are children on the autism spectrum who have problems with gut, constipation, any issues. And if there are symptoms, they should be investigated for gluten sensitivity and then started on a gluten-free diet. असे अंधारात तीर मारणं की प्रत्येक मुलाला आपण दूध बंद केलं आणि चपाती बंद केली is a completely wrong way of doing it, because a child will suffer nutritional deficiencies and will end up causing more problems. So gluten-free, casein-free diet at present is not an fully evidence-based in literature. But yeah.
The question from Dr. Archana Joshi: what is the natural history of autism? How treatment changes it?
Correct. So that's exactly what we said. Prognosis मध्ये आपला early identification will improve the child's trajectory. आपला support will improve. But the intrinsic factor जो आहे की child ची IQ level काय आहे, cognition काय आहे, त्याचे comorbidities काय आहे, त्याला आपण कसं handle करतो, त्याला काय support मिळतो, family कशी आहे, त्याच्यावरती ह्या सगळ्या final important आहे. The whole point of early diagnosis and early treatment is if a child was to have severe symptoms, we should try and make it at least moderate. A moderate child should become at least mild, and so on. Till if there was borderline, we should have फक्त विक्षिप्त आहे, पण diagnostic criteria may not be fulfilled.
I have seen your 2 videos on YouTube. They were excellent videos.
Yes.
Where your autistic children around age of 15 and 18 years were saying that we are special, we are different, we are autistic, but we are not means we are not on society, we are independently at our own thing. But that was at the age of 15 years, 18 years, right?
मुलं जी आहेत ना ती मला वाटतं एक साधारण 19, 20, 21 वर्षाची आहेत.
So,
because they have finished their graduation.
So they are following up with you for how many years? And
so a lot of times what happens is ही जी mother होती, okay, she is the mother of Rishabh Raj Bhatia from that video. Okay, now they initial सगळं ते झाल्यावरती मग ते 10-12 वर्षानंतर मग हळूहळू तो follow up कमी होतो, because parents get empowered. They have their own. We have a forum for autism parent support group, and that is really crucial to help these parents because they help each other. And then maybe 6 monthly visit किंवा annual visit किंवा दुसरे काही नवीन problems crop up झाले की मग connect करणं अशा प्रकारचं.
So हे तुमच्याकडे कधी आलेले आणि किती दिवसांनी ते लोक इनिशियली फॉलो अप करायचे? Because we don't have a developmental pediatrician, we don't have a child guidance center with us.
Right.
We have few occupational therapists, few speech therapists.
Yeah. So initially, if suppose a child comes to me now, to my center for intervention, आता मला भेटल्यावरती suppose I start intervention. तर मला भेटलं, मी सांगितलं की हे symptoms वाटतायत, आपण हे चालू करूया. मला भेटल्यानंतर मी त्यांना म्हणते मला परत तुम्ही 8 ते 10 आठवड्यांनी भेटायचं. आणि this visit is a must. Because आणि का भेटायचं? तुम्ही जे काही गुगल सर्चेस करताय ना ते सगळं सर्च करा, पूर्ण जग सर्च करा, पण त्याच्यावरती काम नका करू. डोंट ऍक्ट ऑन द गुगल सर्च. राईट डाऊन ऑल युअर क्वेश्चन्स, मेक 50 क्वेश्चन्स. In 2 months time you start with the therapies which we have said. In 2 months time let's go through all your questions. Camel milk चा फायदा होतो का, GFCF चा फायदा होतो का, होमिओपॅथीचा होतो का? Let's go through all of that. Let's understand what works and what doesn't work. In these 2 months you are not going to do anything from Google except write it down. You are going to do exactly what the therapists are going to tell you. आणि तुम्ही अशा प्रकारे तो प्रोग्राम करणार. मग जेव्हा या 2 ते 3 महिन्यानंतर जेव्हा मला फर्स्ट विजिट असते तेव्हा बऱ्याच पेरेंट्सना जर थेरपीचा फायदा दिसला, it becomes very easy. Now if it happens that the child is not coming to my center, and there are many children who may be from Kalyan or who might be from Borivali and they are coming to me only once in 3 months. So I will not call a child from Kalyan to my center. But I do, I can see Kamini here, and I do, many years back when there used to come patients coming from, थोडंसं ते कोऑर्डिनेशन झालं पाहिजे की काय थेरपी मध्ये झालं पाहिजे, तुम्ही काय करताय. सो व्हॉट आय टेल द पेरेंट्स इज, आपण जेव्हा 2 महिन्यांनी भेटतो तेव्हा एक ना एक रिटर्न रिपोर्ट किंवा सम मेसेज नीड्स टू कम टू मी फ्रॉम द थेरपिस्ट, इवन इफ द थेरपिस्ट इज नॉट विथ मी इन द सेंटर, अबाउट व्हॉट इज हॅपनिंग, व्हॉट आर द things that she is working on, how are the parents doing their home program. So I get a feedback from parents and I get a feedback from therapists. And then I'll ask them to get some videos about how they are doing. So I put a lot of effort in my second visit. So पहिल्या visit मध्ये होऊन जातं ते सगळं, पण जो second visit असतो ना, it's really important to know to retain parents into therapy. ही visit आपली झाली नाही ना, मग ते 4 आणि 5 महिन्यानंतर ती मुलं कुठेतरी काहीतरी भटकत असतात. ह्या थेरपिस्टचा फायदा नाही झाला, मग त्या थेरपिस्ट कडे जातात आणि it all goes haywire.
No, I think what Leena he wants to ask Shailesh is just like nephrologists follow up nephrotic syndrome because adults don't see it. I think he wants to know whether as a developmental pediatrician, autism belonging to our specialty, do you see adults with autism as well?
No, I transfer them to adult psychiatrist if needed. By 18 or 19, they हळूहळू transition सुरू करते.
Second video I saw from your collection, and that was from your center, ICANN.
Yes, yes.
And there were 5 therapists. One was occupational therapist, one was speech therapist, one was psychologist, one was special educator, and one I don't recollect the 5th one. 5 of them were
Early intervention.
Absolutely. So 5 of them were doing 5 different things on one particular child. We don't have such facility over here. Second thing, at your center, my question comes over here. At your center, doing 5 therapies for 1 month, what will be the cost and how effective it will be without the therapy, without 1 or 2 prongs of them working together, like speech therapy, occupational therapy, or early interventional, or something like that, and all 5 together working, and the cost of it.
Okay. So actually, I do not, suppose a 2-year-old child comes, I'm not going to start special educator and counseling and everything on that child in first 2 months. It is a step-by-step process. So the first thing is early intervention, where the therapist teaches play, eye contact, joint attention, basic play. आणि मग आपण ते step by step करतो. Okay. So as I showed in that one of the slides, the session 1, session 2, once a week kind of thing होतात. Once or twice a week with parental home. So the entire process मध्ये parent sits inside, learns what is to be done in small bites, goes home, takes videos, sends to the therapist, and then proceed ahead the next time. So it has to be done in a very specific way. It is different from every child. Suppose 6 वर्षाचा मुलगा आला तर काय मी early intervention करणार नाही. Then I look at what does he need. Does he need medications? Does he need occupational sensory processing? आपण एक assessment करूया. What are his sensory needs? Does he need a communication मध्ये आपला direct AAC ला जायचंय का? So we have once or twice a week team meeting where we discuss every child in an integrated way. So this is how we work. But that doesn't mean there are different ways of working, but this is the way I work in my place.
Cost?
Cost depends because cost is relatively cheaper in our this thing simply because we are based in Palghar. So what I've heard is OT sessions might be costing like 2,000 in Andheri, for example. आमच्या इकडे साधारण एक 700 ते 800 per session.
I think we should not discuss cost because this is invaluable.
No, because the thing is that
second goshte, I do not believe in packages.
Yeah.
So I don't do packages myself in my this thing in my because I believe that is a business model. And again, there are no rights and wrongs. Each one has a personal practice. There are no rights and wrongs. Let's be very clear about that. If you meet 10 developmental pediatricians, there will be 10 different ways of doing it. My way is I do a session-wise kind of thing with this kind of practice, with parental training. So the onus is on parental teaching, with parents sitting inside. Nobody, I don't want to see any parents sitting outside in reception without any particular reason.
Excellent. Leena, we want you to share 3 charts. One is the chart where you said immunization. You have, I've seen this chart before, but haven't been very alert to noting.
Yeah. So I think if you, next time you make files, just put that column. It is beautifully, useful and very easy.
Yes. So we
मला एक ईमेल पाठवा मी तुम्हाला देते म्हणजे मी त्याच्या डिस्क्रिप्शन बरोबर तो चार्ट पाठवतो.
Sure. So one is that chart. One is the chart to put in OPD, which you said it's like a checklist for parents. And the third is an M-chat. Of course, that's available, downloadable. But if you have it, then you said you will send a PDF to Shailesh. So please send these 3 charts, and we will surely include that in our this. Leena, you've spoken so beautifully and so much at length and described everything. I remember when you had come with Pankaj some years ago, and we were equally impressed. But today there's so much more detail that you have shared. And there's one question: how do we judge the IQ of a child with autism? Because it will be very.
I think it is the best question, because when we say ki prognosis depends on IQ, the IQ कसं judge करायचं? आणि it is a difficult one, because take in consideration that there's this child who is unable to take instructions, scared of bright lights, आणि त्यांना आपण ह्या अनोळखी माणसाकडे ह्या टाइम्ड प्रोसेस साठी पाठवतोय with bright lights, the child is not going to respond. So IQ, first of all, we have to remember and understand why are we doing the IQ of this child. This is the important bit. Is it for documentation somewhere? Is it going to help the child? That IQ level is going to help the child? Is it for our sake, or parents want to know? कारण त्याच्यावरती डिपेंडंट होतं की तो जो नंबर येईल त्याचा काय उपयोग करायचा. सेकंड गोष्ट आहे, when we talk about autism spectrum, it's a mix of abilities and disabilities. Okay, so they might be very good in some and they may not be very good in some areas. So when we do a normal IQ test, आपण समजा ते विस्क जे म्हणतो, वेशलर्स म्हणतो, सगळ्यात चांगल्यात व्यवस्थित जरी आपण केली ती टेस्ट, तरी त्याच्यामध्ये जो नंबर येईल, सपोज द नंबर कम्स ॲज 100, सो द IQ इज नॉर्मल, बट अडॅप्टिव्ह फंक्शन जे आहे, सो एव्हरी डे त्याचे जे डेली नीड्स आहेत, त्याचं कम्युनिकेशन कसं आहे, त्याला काय काय करता येतं, that is more important in terms of living independently rather than an IQ. So you might have, so for example, I have children, well, I know of children, so 10वीची परीक्षा मेनस्ट्रीम मध्ये दिली, 10वीला 91% मिळाले, मॅथ्स मध्ये 100 पैकी 95 मिळाले, everybody is happy. But only I am unhappy, because if this child is asked to given 100 rupees and asked to go and buy a bread of 30 rupees, he will not be able to do that. So what is more important? Is academic excellence more important, or doing teaching the child social daily life is important, is what we need to understand. आपल्याकडे most schools and parents and families unfortunately chase academics, and it is our duty to teach them that this is not what you want from the child. So after a certain age, what I tell parents, I'm not going to tell you what you should be doing with the child. You are going to decide the goal. तुम्हाला मुलामध्ये 18 वर्षाचा काय पाहिजे. तर somebody says की नाही, ग्रॅज्युएट झाला नाही तरी, डॉक्टर झाला नाही तरी चालेल, पण ग्रॅज्युएट तरी पाहिजे. म्हणजे that is a wrong expectation. So you need to discuss. This is an ongoing process. Okay, you need to discuss with the parents की मग आपण आता पाठी, सो आपल्याला काय पाहिजे, आपल्याला इंडिपेंडन्स पाहिजे, आपल्याला त्याला थोडं तरी लिहिता वाचता आलं पाहिजे, फंक्शनल अकॅडमिक्स पाहिजे, आपल्याला त्याला थोडा तरी काहीतरी कम्प्युटरचं नॉलेज पाहिजे, बिकॉज that's the best thing for children on the autism spectrum, right, where public relations are not. So then now their child is 10 years old, let's talk for doing algebra and geometry. कारण अल्जेब्रा आणि जॉमेट्रीचा त्याला उपयोग होणार आहे का, unless he's very high IQ and he's doing. So I have children who are doing PhD. In that video, there's one child who's doing something in maths, some post-double graduation in maths. But he can also go by the rickshaw, and he can also manage his finances. In my eyes, that is more important. So te jamta and he jamat nahi hai, that would be difficult. Okay, so I think this kind of ha jo nazar ahe na बघण्याची मुलाकडे, ती पालकांची आपल्याला बदलली पाहिजे. सुरुवातीला they follow us, but after a certain time, I say, get your goals, what you want. Let me understand whether what you are thinking is right or not. And then we change. Then you tell the therapist that Elana buttonच लावता येत, can we work on that? तर ते पेग्स नाही घालता आले तरी चालेल, म्हणजे तेच आपला जो गोल आहे, त्याला पेन्सिल पकडता नाही आलं तरी चालेल, मी त्याला माउस ट्रेनिंग करेन, त्याला लिहिता नाही आलं तरी चालेल, I'll help him on the computer. So after a certain points, goals should come from parents. They should discuss with the developmental pediatrician or the pediatrician, and the therapy should be around this. So the child centered asla pahije, not center.
Dr. Bhadbade had a question.
Yeah.
Yes, sir.
You said you administer MChat at 18 months and 2 years.
24 months.
Yeah, 24 months. Yeah. So are there any red flags where by which you can even identify kids even before that?
Oh, so the developmental, so screening test ji MChat ahe na, that is that has been this thing for standardized for 16 months to 2.5 years. Okay, so under 16 months that has not been standardized, so it can be used 16 months onward. Before 16
MChat.
MChat cannot be used before 16 months. But before 16 months, all our developmental, whichever I have written in communication, response to name, all those developmental surveillance charts will have those points, which you should be kind of ticking or crossing, which makes you aware, okay, he's not responding to your name, does not mean it is autism. You could ask parent, do you call him Ravi, or do you call him Babu, or do you call him, because you might call him Ravi in the clinic and the parents are calling him by another name. So we need to kind of have a discussion around that. Of course, then you're worrying about hearing, other things as well.
And what I was going to ask you was the importance of screen time.
Screen time is mobile and TV. So the current mobile and TV, tablet, anything with a screen. So it can be mobile, TV, laptop, tablet, je kai ahe te. And handheld screens are the worst things for a child.
Exactly.
Parents think that they can see YouTube videos. At least the TV is far away. Okay, so between a mobile and a TV is less of a culprit. A mobile is a really bad thing for a child under 2 years of age.
Is it because of this that the incidence has increased?
Correct. So there is some study going on, and they found that children, boys, especially the boys, and I'll probably forward it on your group. Study ahe, atta ek recent ahe, because in pandemic they found that children, boys who watched more screen time at 1 year had a increased diagnosis of autism at 3 years. Asa kaitari ek study hai. I think screen time will not cause autism. Autism is a genetic issue.
Yeah.
Genetic problem. But epigenetics manto ki screen time will take away from our normal stimulation, normal activities, passive stimulation. Mulala kai bolaichi garaz lagat nahi, he ek tarfi hoto. All these things are also causing, are adding. So ha problem to genetic issue asel, to screen time mule evda ho. Right? But this problem probably is upazat, genetics.
स्क्रीन टाइम मुळे ते लवकर डायग्नोज झाले असं काय आहे का? कारण की स्क्रीन टाइम मुळे त्यांचं बिहेवियर पीक वरती लवकर आलं, otherwise we would not have diagnosed.
I take credit. I'm not saying screen time. I think we all should take credit that increasing awareness has been and the MChat and all these things are more responsible for increasing the early pickup rather than screen. But yeah, with the screen, parents say ki bolatas nahi, screen मध्ये अडकवलेला असतो, and they might bring the child to us. We need to keep asking about these red flags in our when they meet us for immunization.
Once our therapy is over, the child has come, become functional. How frequently do you need to reinforce?
Okay, so it depends on the child's needs. So the goals are different every time, at every single age, at every single stage. After the first 6 to 7 years of life, the initial therapies, the OT made, there are some other things which are happening, can be normalized into physical activity. So balance, coordination, fine motor activities which are happening in the first 2 years, 3 years, 4 years of life can be transferred to skating, gymnastics, swimming. So it can be, we can try to normalize that into daily life. Lot of changes which can happen because apan म्हणतो ना neuroplasticity, 3 years, 5 years, 7 years. So we want the therapies till about 7-8 years, they work very well. After that, that efficacy or rate may probably plateau. Then we go more into kind of educational models. as the child grows older, educational models and what is needed for the child. So if the child is verbal, childची level IQ level काय आहे किंवा pickup level काय आहे? Is he somebody who's memorizes and writes things? Is he a visual learner? मग त्याला आपण शिकवायचं कसं? आणि त्याला आपण काय शिकवायचं? Are we going to teach him this? So this is all decisions which happen with every child, with every family, and it's a process. It cannot be a one thing, because no parent will want their child out of mainstream school. And we should not put any child out of mainstream or in special schooling till a certain age, because पहिले 5-6 वर्ष जे आहेत ना, these are ages of imitation. So what we want is normal role models around them. So when we go into a special school child, there are different problems in children. So the role models may not be ideal. In an age of imitation, in a younger child, we want them around children who are developing, speaking, behaving normally, so that they can learn, pay attention and imitate them. So that is why even for when we talk about special schooling, however severe the child is, I usually do not recommend until a certain age.
Normal school don't take them.
That is true. According to Right to Education in our PWD, they should. So it is written that it should be written, it should be done. But practically काय होतं हे आपल्यालाही माहिती. Okay? आणि समजा जर घेतलं तरी ते passive inclusion असतं. So active inclusion नसतं. Or passive inclusion ला problems are highlighted, and then they will ask for shadow teacher, and then it just, it's just a mess. And there are no right answers. We really need to kind of help each family and each schooling as it is. And see whether the child, second thing is whether the child is really ready or appropriate for mainstream. म्हणजे त्याला जर ABCDs म्हणजे येत नाहीये आणि आपण 4थीला बसवतोय just because his age is 9, that is we are doing wrong thing. So we need to counsel parents. See, why are we making him sit in a 4th grader when he doesn't know a 1st grade curriculum, right? So किती तुम्ही IEP केलं तरी ते 3 वर्षाचा गॅप 4 वर्षाचा गॅप कसा निघून येणार आहे? मग are we doing the right thing for the child? What should we be doing? What should be our focus? Should it be NIOS curriculum? Should it be functional academy? So that's the process.
Ma'am, I have a question. Ma'am, do these children get anything like in the disability certificate? Do they come into that category or not?
So previously, the old PWD, Persons with Disability Act, did not include autism. Now this revised one, 2016 one, which is RPWD, has included autism. So they get all the disability concessions, whatever is what is given for any child with disability like hearing, vision, cerebral palsy, all the concessions and whatever is available for these children. So this is included in the Disability Act now. So yes, and you can get an UDID number, which is Unique Disability ID, and everything is available. All information is available on the net, and it's really very easy to do that.
For autism level of more than 40%, you get disability certificate.
Correct. That's because autism level काढणं सोपं नाही. Okay. पण समजा आपण लेवल काढतो तर लेस दॅन 40 म्हणजे आपण माइल्ड ऑटिझम. Okay, so then you can see whether this mild autism is getting moderate or worse or severe or whatever as the child grows older. Which is the needs, social needs are वाढले, so then maybe reevaluate that in a few years time. Okay.
Ma'am, I just had a small request or a suggestion, you can say. So I'm Audrey, I'm a speech therapist. I work in the Vasai area. So normally what I do is during the hearing screening itself, when we do newborn hearing screening, I counsel the parents so as to focus more on the communication, the play with the child during the screening itself. Either, before the child gets discharged or during the first 10-20 days of birth. And I tell them that till 2 years, till 2.5 years, you shouldn't be exposing the child to any type of screens. And these are global guidelines. These are followed all over the world. These are recommended, not followed, I would say. So I would suggest that even in our OPDs, because the parents tend to listen more to the pediatricians. If they, say something, they would, heed their request. So during the OPDs, when the child is months old itself, you start counseling them that, there should be no screen time at all for the kids.
No, Audrey, you're absolutely, hit the nail on the head. In fact, what I say is the way we write on the files, breastfeeding is nectar for the child. Breastfeeding is must for so many months, all those things. In red letters, you should be writing screen time is hazardous to your child's brain. Write it in red letters and leave it there. Because this is our, on our file, they will be looking at every time they see the file, it will come to their attention. The hearing screen, again, I did not, I put it in the slide, but I did not get to talk about it. I think we need to start, if we are not doing for every child, we should be doing hearing screen for every child. And at that time, just because a child has passed hearing screen, we need to give a leaflet to what speech milestone the parents should be looking out for. Yes, agreed.
आम्ही जर YouTube बंद केला तर व्हिडिओ दाखवाल का तुमचे?
बघते ह्या लॅपटॉप वरती जे आहे ते बघते.
You tell me, I'll stop streaming.
माझं एक लास्ट क्वेश्चन. एखादा गरीब पेशंट आला, त्याला आपण ऑटिस्टिक सारखा वाटला, पण तो काहीच मी पुढे तो परत येणार की नाही मला माहिती नाहीये. तो ऑक्युपेशनल थेरपी किंवा स्पीच थेरपीचे सेशनला येणार की नाही मला माहिती नाहीये. किंवा वाड्यामध्ये, वाडा मोखाडा या एरियातला पेशंट असेल जो इथपर्यंत येतो, पण त्याला स्पीच थेरपी आणि ऑक्युपेशनल थेरपी मिळणार की नाही मला, इट्स ए क्वेश्चन मार्क. सो व्हॉट कॅन आय डू इन 1 or 2 sittings where I can make a little 5-10% difference in his life?
So this is what you need to think. So की आपण जे स्पीच वरती, सी स्पीच आपण काढू शकत नाही. There is no way of getting a meaningful word out of a child's mouth. We can get repetitive words, but getting a meaningful word is not, you cannot do in any way. What you need to work on is the pre-speech. जसं आपण बोललो, how to play with the child, how to get eye contact, joint attention, imitation, playing, you helping him in your everyday activities, giving te आणि घे. आणि in fact, urban area peksha rural area चे parents are very good in this. I remember getting one, she never came back to me again, of course, and I'm lost to follow up. But when she came, she said, नाही पण ते ना मी काय करते, इकडे मोहरीचा मसाला ठेवते, इकडे हळद ठेवते, आणि त्याला मी सांगते ते मसाला घेऊन ये, हा हळद घेऊन ये. म्हणजे ते त्यांच्या ह्याच्यामध्ये ट्राय करतात कसं तरी करायचं. यू जस्ट नीड टू टेल देम द कॉन्सेप्ट्स. टेल देम स्पीच वरती आपण नंतर बघूया किंवा होईल किंवा नाही होईल, पण कसं तरी कम्युनिकेशन त्यांनी जेस्चर्सने वगैरे झालं पाहिजे. बिकॉज वन्स दॅट इज एस्टॅब्लिश, बिहेवियरल सिम्पटम्स थोडे कमी होतात. And that's all that we can offer in our OPD. There's not much that we can offer unless they keep coming.
How common is the learning disability as a comorbidity with autism?
Quite common. It's
Very
difficult to, it's quite common, but it is difficult to label.
Yeah.
So when you talk about ASD, then there is ADHD, then there is LD, then there is psychiatric problems. So there is so much of overlap.
Overlap.
It becomes difficult to test these children. It's not easy thing to test. So you need a lot of, you need a psychologist who one has a lot of patience, experience, training, and a lot of time on her hands, because I tell them, don't do this assessment in 1 sitting or 2 sittings. Let it be over 3 months. See the child, so you come to know the child, and then ask the parents to do videos, what the child can do at home. So it's not very easy to do that. So you do end up writing as diagnosis. When you do certification, there are diagnoses as ASD plus this, ASD plus that. It is not very easy to do that. But yes, can be done if we ideally should be done.
How do we, find out special qualities? Because I know of one autistic child who's a fantastic cricketer. I know of another who's a fantastic painter, although no one would have imagined he has noticed such things, Like he has never spoken, but he has drawn girls with ponytails flying in the air. And
I have some pictures. They're absolutely very good with their art and craft. Lot of children are. So I'll tell you, I mean, I know I don't know where to find. We know of some in the area who might include, but I don't think there is a database as such. But these children, if you see the video of mine where I have shown 5 children who are grown up, they are going to these normal colleges with inclusion. Okay. What I was saying was, I saw this girl just last week. I have her painting somewhere. So she's moderate to lower socioeconomic. Okay, moderate to severe. म्हणजे त्याचं आता ती काहीतरी 7 वर्षाची का 8 वर्षाची आहे. शाळेत काय करत नाही. 2 वर्ष पॅन्डेमिक मध्ये एनिवे गेली. थेरपी काय झालेली नाहीये. how do you start helping this child? And then this parent brings out this drawing book where she's drawn beautiful paintings, beautiful, and I'll send it on the group maybe. Beautiful. Shivaji kadlai, Ganpati kadlai. So if we can take this child ahead, if she gets the right guidance, we can take this child. She might need some functional academics independence, and then take her ahead in this painting. It would be त्या मुलीचा prognosis ह्या direction मध्ये जाणार, good direction मध्ये जाणार. पण त्याच्यासाठी resources वगैरे पाहिजेत ना, availability पाहिजे. All these are ideal things. Yeah.
Share your email ID on chat. So
I will.
Yeah. So we can request for the charts what Anjali mentioned to you.
Yeah.
So I'll send it to you, Dr. Anjali, and you can circulate around.
Yeah.
Yes,
Our
Leena.
email ID is drleena.deshpande@gmail.com. Dr. Leena. हाँ sir, Hemant sir.
B for video.
Okay.
May I have to